We are going to be covering maternity part 1 today. So I always like to start that your legacy is being written by yourself. Make the right decisions. So I think one of the right decisions that you guys have made, that you are here. So I'm excited for that. And you will know why this is the right decision, because we will do anything and everything within our power to help you become successful. Okay. So my class starts with a little bit of housekeeping. And what is the meaning of housekeeping in like Canadian culture? It talks about what are the expectations and what you should be doing. And you guys have heard about when you attend the big meetings or something that, oh, they talk about housekeeping. So join the class on time through the roster. I know I will be sending the links for the first 2 weeks as promised. Right. But again, after a couple of weeks, the links will only be available on the roster. It's not that you're never going to have the link. Sometimes students still ask and we still send the links. But recommendation is that join the class through the roster. It avoids confusion. Please ask the question after the topic is finished. I encourage you to ask me questions. But sometimes when you have a question, I probably already have that in the topic. So give it a chance. Give me a chance to complete my topic. I will be the one asking questions, but you can always raise your hand and ask me questions. I'm always open. If you have questions in the middle of the topic, please write them in the chat. Use the chat on the Zoom. Everybody is familiar with Zoom a little bit now. It will take more time, but it's okay. We are learning, right? We're gonna learn Zoom. It's a different online world. I wish I could teach all of you together in one class, but for that, you guys have to move. Okay, move from one place to another because we can only do class at one time. Okay, there's a high chance that your question will be answered by the end of the topic. So be patient, hang in tight. But if you have a question, do not hesitate. Write it in the chat for me and I will do my best to answer, because usually I read the question from the chat and I will just answer it. Please keep your video on if you can. I understand that some of you can't. The reason for that is attention. Like I can look at you, I can read you, I will be paying more attention. So like people who are not on video, I totally understand. You have XYZ reasons, but that's like, if you can, that would be awesome. Okay, I'm gonna let the student in. Use the icons and hand raise option for any queries. As I said, that there is options. Learn about them. Slowly we're gonna know. Use one sheet method. How many of you are already familiar with one sheet method? You guys know, have you started, Shalu? I see your hand up. Okay, Annapurna, you know it from. Okay, Judge knows. Okay, Puneet. Okay, good. Like few of you already know. We're gonna learn more about them. Parvinder, good. Okay, that's great. Taran, Pearl, Sruja. Awesome. Great. Trust me when I say this, it is an amazing thing that one can do for themselves, making one sheet. Okay. So like if you guys still have questions about one sheet, we're going to keep asking, keep practicing. With practice, you're going to get better. Review the presentation before the class if you can. That's amazing. It's just skimming. So for example, if I tell you, can you just read this whole book in 5 minutes? It's not going to happen. What do? You just skim through it. What are the topics? So if I ask you right now, what am I teaching? Can someone tell me what am I teaching today? Raise your hands and tell me. I want to know. I want to know if you guys got an opportunity to. Okay. All right. Dheeraj, what am I teaching?
Maternity.
That I know. That everybody knows. But what are the
topic?
Pregnancy.
Pregnancy.
Okay. Parul, what am I teaching, Parul?
Sign and symptoms of pregnancy, presumptive, probable, and positive. And
exactly. So I am gonna give you. So Parul is my student from, like, she had to leave the batch in the middle, so she has come back, but she knows me. So the reason she's telling you anatomy of pregnancy, sign and symptoms of pregnancy, because she knows me, that's how I want you to know what am I gonna teach. Is your brain primed enough? Have you oiled your brain that, okay, this is what I'm gonna learn? Okay. So next time when I ask you, what am I teaching? The answer is not maternity. The answer is the breakdown. What am I teaching? Okay. Use active recall to write the things on one sheet. avoid making, so when I say avoid, please try not to make any notes during the class, because what are you going to do? You're going to just keep writing. I don't want you to write. I want you to listen, pay attention to me, because the more you're engaged in writing, you will forget what I'm saying. Okay. Most of the topics when the students do questions come from the recorded lessons. You know why? The answer is because when you're listening to the recording, you're actually paying attention to listening. Sorry, I'm just going to mute you. Okay. Respect, listen to the lecture during the class, respect each other. We have multiple ethnicities. It's not only, we have students from everywhere. Okay, so you will notice there are students from Nepal, India, majority, then Ghana, Nigeria, like so many ethnicities are there. I'm sorry if I missed something, Philippines. So please respect each other and try to learn from the experiences of others, because sometimes when the students share their experiences, it's amazing. Okay. So now the topics to be covered today: anatomy related to the pregnancy. Okay. Why is it important? Like, why do you even care about anatomy related to pregnancy? I'm going to tell you why. It's very important. Sign and symptoms of pregnancy. So can someone tell me what are the sign and symptoms of pregnancy? Oh, I have somebody.
Presumptive signs.
Sorry?
Presumptive signs.
Presumptive.
Probable. Positive signs.
Okay, good. Kulbir, did you want to say something?
Presumptive signs.
Presumptive. Okay, good.
Presumptive, probable, and positive signs.
Okay, good. That's good. Okay, and then we have Nigel's rule. Anyone knows what is Nigel's rule?
Yes, it is used to calculate LMP, last menstrual period, and
Okay, so we're gonna talk about it, and like one thing you will learn in the classes, that little knowledge is the most dangerous in NCLEX. Has anyone ever felt it? If you guys have written the exam before this, if you know something, I want you to know it like the back of your hand. Like, oh, I know exactly what's on it. Okay. So Nigel's rule is not to calculate the LMP. What is Nigel's rule used for? Anybody?
EDD,
Expected
date of delivery.
date of delivery.
Expected date of delivery. Not the LMP. Okay. What is next? GT-PAL. What is GT-PAL? Anyone knows what is GT-PAL?
Gravida, parity, abortion, and live birth.
Live birth.
Term.
You guys lost me all. It's okay. Next time I'm learning about you too. Raise your hands, because everybody, like one person is saying gravida, other is a term. Someone said abortion. That's good. I don't know. What about P? What is the P?
Parity.
Parity.
Okay. All right. And how many of you have already studied maternity? Everybody pretty much, right?
Yeah.
Okay. So the P here, the students who are saying parity, I will question that, and I want you to pay attention. Okay. We will be doing practice questions. We're going to do a case study today. Changes during pregnancy. What kind of changes are we talking about? What changes during pregnancy?
Like hemodilution, and then we have weight gain, then some changes in the
Kulbir?
breast and
GI changes.
breast
Changes.
linear, something like that.
Okay, all right, that's okay. So I am going to recommend that you guys raise your hands and answer, because I really want to listen to what you have to say. So I'm going to start with anatomy first, and I will explain the importance. So you need to know this is the normal anatomy of pregnancy. Where is the placenta? What's the location?
Upper side.
Fundus of the uterus. Do you guys remember the uterus? Fundus. Okay. All right, I'm just gonna mute. Guys, please keep yourself on mute, because you guys are talking and it. Okay, all right. So placenta, what would be important in maternity about placenta? Abruptio placenta, right? What is the meaning of abruptio? Abruptio means abruption, means break. It has broken. And abruptio placenta, I'm going to go in details with every single thing. This is just an overview of what I'm covering. Abruptio, the A for abruptio stands for accidents. Okay. So abruptio placenta. And then we also talk about placenta previa. So I always tell my students to be PPP. And what is PPP? Placenta previa is painless.
Yes.
Abruptio placenta has abdominal tenderness, abdominal pain.
Painful.
Okay. Umbilical cord. What is the meaning? What is the most concerning part about umbilical cord? Umbilical cord should have AVA. What is AVA? AVA, 2 arteries and 1 vein.
One vein.
Ventricle.
Okay. So other thing we need to remember about umbilical cord, that it could be prolapsed cord, and prolapsed cord is an obstetric emergency, and NCLEX loves to ask question on this. NCLEX love all these little things. Abruptio placenta, placenta previa, prolapsed cord. We will also be talking about decelerations. Decelerations means D is decrease. Decrease in the heart rate. We're going to talk about all about fetal monitoring and everything. Okay. Next, fetus. Of course, the position of the fetus is more important, because what kind of presentation is it? Is it cephalic, breech? What kind of presentation is this? If the buttocks are on the top, that's the kind of presentation we like, because it's cephalic presentation. Okay.
Cephalic presentation.
Cephalic presentation.
Okay. Please keep yourself on mute. I will ask you questions. So right now, let me go with the flow. So that, okay. So next is amniotic sac, and the importance of amniotic sac. Where is the baby? In the amniotic sac. It's like a bag. This is the water you're talking about. The water broke. What should be the color of amniotic fluid?
Amniotic fluid.
Transparent.
Raise your hands,
color.
please, guys.
Straw color.
Raise your hands. No. Please raise your hands. And use the gestures. So Annapurna, your hand is up with the gesture, so I'm gonna go to you.
Yeah, it's a straw color.
Straw color.
Amniotic fluid.
Then why do we say water broke? Why water? If it's straw in color. Kulbir?
No, actually.
Yes, ma'am.
I think we have it like, is my
It's a
internet okay?
straw.
Can you guys hear me properly?
Yes, ma'am.
Okay. All right. Binder. Binder, do you want to answer? Your hands up. Parul?
I think it's transparent.
Okay.
Clear.
Why do we say water break? I want to know that. And I'm going to talk about this. Oh, it's clear. So Binder has texted clear. So when you say water break, that means it's colorless. How does the water look like? Colorless. No smell. Okay. So that's why amniotic fluid should be colorless. Straw colored is not the right answer. Okay. Then cervix. What is the importance of cervix in pregnancy and labor? Raise your hands. Manya?
It get effaced up so that it helps the baby to push out from the birth canal.
What do you mean by
And it even
efface?
gets dilated.
What is the meaning?
Efface mean like whenever like the baby's head is going down, it gets effaced up. That means it
What-
gets stretched up and filled up and gets thinned up. So that's
Thin.
known as efface. It
Okay.
gets taken up.
Thinning of the cervix is known as effacement. Okay. So effacement is a terminology. So another important thing I want you to remember, especially like in our classes, you have to Google the words. If you don't know the meaning of the word, you have to go to your phone, Google the term, what it is. Because in NCLEX, the question, everything is going to be asked in English. Long questions are asked in English. And if you go into translation, you will lose a lot of time. Okay. Bladder, why is the bladder important? Because you will have urinary frequency. When do you have urinary frequency? Which trimester?
Third trimester.
Sorry, what's your name, Sarnia?
Third trimester. Third trimester. Yes, my name is
First and
Sarnia.
third.
First and third is the right answer. First and third. Why in the first, Dheeraj? Why in the first trimester the female has frequency? No. Anyone else? Why do you think female has frequency in the first trimester? Because, like, you know, that's how people kind of assume that I'm pregnant because I'm going to the bathroom so much. That's frequency, right? Like going to the bathroom again and again. Annapurna, is your hand from the previous one? Because I think I have two hands. I have Manya and Annapurna. What about other people? So first, I will just tell you. So the uterus has something in it, which is like the zygote, the cells. So as soon as there is something in the uterus, the female starts feeling the pressure on the bladder. Even if it's a minor pressure, it will give you the sensation that, oh my God, I have to go to the bathroom. I have to go to the bathroom. In the third trimester, why do you have frequency? Because of the engagement, the descent of the fetus, the baby's head getting engaged towards the end of the third trimester. So that's why there are 2 times during pregnancy when the female can have frequency. Vagina, no, most of the time it's a vaginal delivery and the location of the anus. So this is just an overview of anatomy. It's important for you to know what things are normal anatomy and what is abnormal, okay? So we will start with presumptive, probable, and positive signs. So raise your hands to tell me which, okay, right. Okay, so I'm just gonna go to the first because then I'll ask questions. I do have questions. So presumptive means presume. What is the meaning of presume? I am assuming. Subjective, who is assuming? The mother. Okay, so the mother is assuming she's pregnant. How do you, if you like ever had a pregnancy, how do you feel that you were pregnant? I'm going to share my experience because I don't want to put anyone at the spot. Dheeraj, you want to answer that? I'm okay with that, but I can take my example. You're on mute.
First symptom is amenorrhea.
Okay, amenorrhea is the
When
first
we miss
symptom.
the
Yeah.
period. Yeah.
Okay,
And
so
nausea and vomiting.
nausea and vomiting is a good one because, you know, all the movies
Yeah.
that you guys see, especially the Indian Bollywood movies, what is happening? How do people suspect she's pregnant? Because she's just running to the bathroom to throw up.
Nausea and vomiting.
Sorry, Asta had to mute you because of the background. So nausea and vomiting, right? And why do you have nausea and vomiting? What is the reason for you to have nausea and vomiting?
Because of the
Because of
HCG
hormonal
level high.
Hormonal changes.
Hormonal changes, HCG.
Yeah.
Human chorionic gonadotropin hormone.
Chorionic gonadotrophic hormone.
Okay. Nausea and vomiting, then breast enlargement and soreness. Absence of the period is usually the first thing. Then you combine things together. Oh, I'm nauseous too. Oh, my breast is hurting and it's sore. What about quickening? What is quickening? And why is it here? Like when do you see quickening? Dheeraj, your hand is still up, so I am gonna come to you. You're like, oh my God, I want to put it down. Okay. Do I have any other hand? Manya's hand is up. Okay. So I think I found people like who are going to raise their hands. And today I'm not going to ask people who are not raising their hands because I don't want to put pressure on you. But I usually do pick up people who don't raise their hands. So rather your hand is up from the screen. I can see. So tell me what is quickening, please.
Ma'am, fatigue, sometime more sleeping.
Sorry?
In pregnancy system, ma'am, sometime more sleeping or every time feel the ma'am fatigue.
So fatigue is a different sign and symptom. I'm asking the word quickening. Quickening is very, very different than fatigue. See, I'm telling you, when you're learning these things, presumptive, probable, positive, you have to be 100%. So, okay, Cynthia. What is
When you feel
Yeah.
Yeah.
It says when the mother feels like there's movement.
Yeah.
In
And
her.
when you feel the baby's first movement.
Sorry?
When you feel the baby's first movement, that is quickening, I think.
All right. So ultimately, when the mother feels that the baby is moving inside me, she thinks the baby is moving. What is the time period when the mother should feel quickening?
16 to 20
16
weeks.
to 20
16
weeks.
to 20 weeks, right? 16 to 20 weeks. Now you'll be like, oh my God, the mother should know absolutely by then that she's pregnant. Why are you taking so long? So this is for the people who live up north. They don't even know they're pregnant. They don't have all the health resources that we do. Okay, so there are people living in like far areas in the cold weather. They don't know. But quickening is the feeling. It's when we say presumptive is subjective. And who is the subject? The mother. Everything the mother can feel is presumptive because she's presuming I'm pregnant. So quickening, when a mother feels the movement of the fetus in the uterus, that is what it is. Why is quickening not a positive sign? Because you can feel something moving inside you because you have gas, peristalsis. So it can't be a positive sign. Okay. So absence of period does not mean you're pregnant for sure. You are assuming you're pregnant. Nausea and vomiting could be related to food poisoning. That doesn't mean you're definitely pregnant. Okay. So there are so many things that why, whenever you get a question on NCLEX, you have to think, oh, does nausea and vomiting means I'm pregnant? No, but it depends what kind of sign and symptoms they are asking. We're going to do questions. So please pay attention because I'm going to ask you these questions. We will be doing a complete case study today on this. Probable. So from presumptive, take the S. S is subjective. Subjective is signature of the patient. Patient can tell you how I feel. Pain is subjective. Patient tells you how much pain I am in. You don't tell the patient how much pain the patient is in. Probable is objective. Take the O from probable and it's objective. And what is the meaning of the term objective? Objective means observable. The signs that I can see as a nurse or a doctor can see. That is probable. The mother came to the clinic, or maybe she did a urine test too, and then she's like, oh yeah, I'm pregnant. So then she came to the clinic. So she did explain all the presumptive signs, and along with that, she did the urine test. But the urine test is what? Probable. Probably you are pregnant. Probably. I am not 100% sure. Because you will be sure when the signs are positive. I'm just gonna zoom a little bit because nobody said that to me. And nice people who are drawing art on my slides, please don't do that. Okay, so probable, objective. Think about the doctor or the nurse. Pregnancy signs that the nurse or doctor can observe. Now there are changes in the skill, like the uterus, the vagina, vulva, the colors. So Goodell sign is a softened cervix. Now, where was the cervix? Remember we talked about the cervix? Softening and effacement of the cervix. So why is the cervix softened? Because it's getting ready. So the whole body is getting ready. That's why all the changes in the color is because the body is getting ready because it's going to have a baby. Okay. So Chadwick sign, C for Chadwick. Chadwick is color. C is color. Bluish color of the vulva, vagina, or cervix. Who can see this color? The doctor or the nurse can see it. Hager sign. So I used to help the students remember Hager sign. When you write the H, what do you see on the top? What do you see on the top? Like if I write H like this, what is this? U. Right? So lower uterine segment, softening of lower uterine segment is known as Hager sign because you will get confused between Goodell and Hager. Goodell is softening of the cervix. Hager is softening of the uterus, lower uterine segment. Okay. Ballotment. What is ballotment? Ballotment is like a bouncy ball. Okay. So when the uterus is pushed with fingers, the fetus goes up and then returns back to its original position. It's known as bouncy ball, like a basketball. So you push the uterus, the baby came back. So it's like that. Okay. So that's what it is. Positive, although like in NCLEX, they are so, like they will confuse students so much. They will write positive pregnancy test and asking about which of the following are probable tests. And you're like, oh, positive pregnancy test is a positive test. It's not. It's not a positive pregnancy test. It is probable. Probably you're pregnant. So presumptive is when the woman is at home and thinking, oh, maybe I'm pregnant. Then she comes to the clinic and she tells the doctor, oh, maybe I'm pregnant. And the doctor's like, okay, let's do an ultrasound. That's when we are like, oh yeah, she's pregnant. So it has stages. Pregnancy does not just, mother may think she's pregnant, but until and unless you have confirmation on the ultrasound, it's still like we don't know. Okay, so why is a positive pregnancy test not a positive sign? Why? Can anyone tell me that? Why a positive pregnancy test is not a positive sign? Why are you saying that, oh, it may be Annapurna? I'm not gonna ask you, no. Sorry, because you're like, okay. Okay, I have, okay, Manya. Anyone else? CO. Okay, let's go, CO. Is that, did I pronounce your name right?
Like Shaw. It's like Shaw, the SHAW.
Shaw?
Yeah, but that's yeah.
No, it's not fine. I want to say your name right. Shaw?
Yeah.
Okay,
Shaw.
so tell me,
So,
why is
positive could be a probable one because it could be a false positive result.
okay, but give me an example. Like, I know it could be false positive, but give me an example where you see a high level, like a positive pregnancy test.
At that point, there's a high level of HCG.
Why?
That makes it positive.
HCG is actually the pregnancy hormone, right? Like when you have a baby, then HCG levels go up. Okay. I don't have your name. It says iPhone, but you have glasses. I don't want to point you out. Like you raised your hand before that. Yeah. Do you want to answer? You have blue t-shirt. I don't know your name. It's not there. Sorry, guys. I'm so bad. Okay. Astha. Astha, you going to answer the question? No, gone. Okay. All right, Manya. Oh no, Astha's going to answer. Astha, what do you think?
Because of the high HCG level and also from the certain conditions or medications.
What like that's my question. Which, like, if, you know, you learn more about me. You can't just give me an answer and like, okay, you figure it out. You have to tell me exactly. So which condition are we talking about?
Molar pregnancy.
Exactly, H-mole.
Yeah.
So it's
Yeah,
not actually the true pregnancy, it's H-mole. Is there a baby in H-mole?
No.
No, there is no baby. So high levels of HCG can be associated with other conditions such as certain medications or H-mole, molar pregnancy. We will be doing H-mole too. It's very important. And we will be talking about fundal height when we talk about H-mole, the prune colored vesicle discharge, all those things, elevated fundal height, high blood pressure, they're all related to H-mole. Now, positive signs. Positive is if I can see it, if I can hear it, if I can feel it. Those are the positive signs. So for me to tell the patient that she's really pregnant, what do we need? Think about the baby. You should be able to see the baby. Where do you see the baby? On ultrasound. You should be able to hear what heart rate of the baby. Or seen, visualization by ultrasound, felt the fetal movement felt by the provider. Does that make sense for everybody? So it's very important. We are not like just stopping here. It's very important that you understand these. Also, because I'm doing a case study, so my expectations are that everybody would know by the end of today what it is. So you can see when I wrote, like we're still gonna go into, because I want to give you something to remember. So signs of pregnancy, presumptive, probable, positive. So the previous slide was from Christine, nurse in the making. Okay. You can see her name here somewhere. Yeah, nurse in the making. And the next slide is from Sarah. So you can see presumptive, I highlighted the S, probable, I highlighted the O, and positive, I highlighted the plus. Okay. You can look here now. Presumptive. So Sarah RN is like most like all about mnemonics and stuff. So presumptive, PRESUME. Okay. So period absent, amenorrhea. I am not a person, I'm never going to tell you, you have to remember them by mnemonics, but do whatever works for you. For me, I will remember this information without, because I'm going to forget what was from the S and probably that is the answer. So try to understand what's going on rather than memorizing, because there's going to be a lot of stuff that you have to memorize. I will tell you, you have to memorize this. Okay. So for example, quickening, when does quickening happen? 16 to 20 weeks. You have to memorize it. So we already have a lot of information to memorize. Wherever you can use your critical thinking and understand the concept, awesome, do that. So period absent, really tired, fatigue. And why is the mother so fatigued in the first, in the early pregnancy? The reason is her body is consuming all the energy to build up the cells. The cells grow rapidly in the first trimester. That's why many of the medications are contraindicated during that stage too. Okay, like stage. Enlarged breast or sore breast, urination increased. What is that terminology? Frequency. Okay. Movement of the fetus perceived by mom, very, very important. Never ever get tricked by it, because if it is perceived by the nurse or doctor, what will it become? Positive, because you could be able, you were able to feel it. So pay attention. These are the movements felt by the mom. Whenever you're doing questions, reading the options, you have to go to the full stop. Don't stop by reading half of the information and then be like, oh yeah, I read it, because they are so tricky. They will give you the first half correct, the last half is wrong. Half correct, half wrong. What is it? Wrong option. And my students who are from the previous batch, they know. I've always told you, you have to go up to the full stop, read all the 4 options, no matter what. No matter what they are saying. I have to read them all. Okay. Emesis and nausea, we already did that. Probable. So you can see Probable. Okay. Sorry, Bianca, do you have a question? You're not on mute. Okay, I'm just gonna. If you guys see somebody in the waiting room, just let me know, okay? Because sometimes I don't know. I know many of the students are from demo. Okay, so positive pregnancy test is probable because we don't know what if it's high DTD for mole. Returning of the fetus, what is returning of the fetus? Bouncy ball, ballotment, okay? Outline of the fetus can be palpated. What does that mean? Maybe the physician is able to see the outline. When they just touched it, they can able to, but they don't know what if it's a tumor. There is no surety. How can you be sure when you feel the fetus parts? Like, oh, I felt the leg, I felt the hand. You know, sometimes you see it on the mother's abdomen. Braxton Hicks contraction. What is Braxton Hicks contractions? Give me a minute. I'm just gonna. False contractions. Okay, Braxton Hicks contractions are false contractions, and we will be talking about them a lot. I'm gonna teach you with like a balloon. Okay, well, like what is the meaning? So Braxton Hicks contractions are like the preparation contraction of the uterus, which do not lead to the delivery, but it's just like a practice contraction. That's what Braxton Hicks is, practice contractions. A for softening of the cervix. Now you need to know. So another quick tip from me. You see how when you write G, what else do you see? C, it's for cervix. Okay, so Goodell sign is for the, if you can remember that way, please use it. Otherwise, whatever works for you, use it. So when you write G, you can see there is a C in it too. So you can remember Goodell sign is for the cervix, and it happens very early in the pregnancy. Okay, this is my color. B, bluish, purple or deep red coloration to the vulva and vagina due to Chadwick sign, and it happens during the first 6 weeks. What is the sign of the lower uterine segment? Hager. Okay, Hager sign, because H looks like. So this is the time when you have to remember information. Okay, this is that time. Hager, you have to remember. Chadwick is color, you have to remember. And softening. So 1 is color, 2 is softening. Color for Chadwick, C is for color. Hager and Goodell are for softening. Okay. Lower uterine segment becomes soft. Hager sign 6 to 12 weeks of gestation. Lab HCG and enlarged uterus. But the uterus can be enlarged due to what else? What if there is a molar pregnancy that can enlarge? Okay, now next, last one is positive. Fetal movements felt by who? By the healthcare provider or the nurse. Okay, but what if it's felt by the mother? What is it known as? What is it known as? Quickening.
Presumptive.
Presumptive and it's quickening. Electronic device detects fetal heart sounds. Doppler. Delivery of the baby absolutely is a positive sign. So she has done FETUS, but you can always remember by if you can see it on the ultrasound, if you can hear the heart rate, and if you can feel the baby. Okay. So delivery of the baby, ultrasound detects the fetus. See visible movement of the baby by the doctor. Outline is a different thing that you assume that maybe there is a baby. But when you can actually see the visible movement that, oh, I just saw the hand of the baby coming in, that is what it means. Okay. So there are maternal changes and hormones. We will be discussing all these signs and symptoms one more time towards the end of the class because we will be doing questions. So that's like a test for you. So maternal changes and hormones. I have a whole section on weight gain because NCLEX love to test you on weight gain. Very, very important. Like I can't even tell you how important this is. And also another important thing that you guys can just write right now is BMI. You need to know the BMI. Can someone tell me what is the normal BMI and what is BMI actually?
Body mass index.
Body mass index, okay. Ishi, what is the normal BMI?
18 to 24.
18 to 24. Yeah.
Wrong. Wrong. Why wrong?
18 points.
Cynthia, you're close. 18.5. I know you know.
Is it 19 to 25?
18.5 to 24.9.
That's right. Who answered that? Who answered that?
Me.
Say your name. I don't know, like, sorry, I have too many people on the screen right now. Who said that? So, Sarnia, is that you? Yeah, 18.5 to 24.9 is the right answer. Make sure you know it's 18.5. This is something again to remember. You have okay. I see background. Sorry, I'm gonna remove you if you don't mute yourself because it's disturbing a lot. I don't know who is not mute. Okay, wait. Okay.
Why don't you mute all?
Sorry. Okay. All right. Okay. So I'm just gonna keep going forward. So weight gain in general, 2 to 4 pounds in the first 3 months. I'm going to tell you exactly how much it is. We will be talking about that weight gain. Anyone knows what is the normal weight gain and how do we do that? Can you guys hear me?
I think 28. I'll be.
For which person?
In pregnancy?
Yeah, like how much? 28 pounds you're thinking is the right answer?
Yes.
Okay.
28.
Okay, that's okay. So there is different variations. There is not a standard weight gain, right? Different BMIs, different weight gain. And we will be discussing that a lot. Like it's very important because NCLEX will test you on that. You also need to remember the pounds and the kilos conversion because it's important. Question will give you like even a drug calculation. You know, RNs don't get a lot of drug calculations, but RPNs do when they write their exam because it's different for RNs. Their focus is different, right? Management of care is primarily your focus. So whenever the question is giving you pounds, divided by 2.2 to get into kilos. Look at what the drug is coming into. It's very important for you to know what is the drugs, like what do I have in the calculation? What is the drug asking me? Okay, next is HCG. And HCG is, what's the purpose of HCG just in general?
It produces estrogen and progesterone.
Okay. Yeah. That's good. So HCG stimulate the estrogen and progesterone, and they both have a role. It's also used in the pregnancy test. So whatever you see on the home pregnancy kit, the urine is what? HCG. So production via corpus luteum to maintain, progesterone is known to maintain the pregnancy before placenta is formed. Now there is functions of progesterone and estrogen, very important. Not so much for what I want you to remember about progesterone. It will be very important because it is for relaxation, and many of the signs and symptoms during pregnancy are related to progesterone. Okay, heartburn. What is the heartburn related to? Can someone tell me that? So progesterone causes the relaxation of smooth muscles. It maintains the endometrium. Endometrium is the lining of the uterus. It inhibits contractions. Why? Why does it inhibit contractions? Because it relaxes. It's relaxation. Contractions are what? Opposite of relaxation. So you want the uterus to stay relaxed during pregnancy. When do you want the uterus to contract? Towards the end of the pregnancy. Why? Because we want the baby out. So progesterone will maintain the pregnancy because it causes relaxation. It aids in duct development for lactation. Progesterone is also responsible for the duct development for lactation. It decreases the smooth muscle tone. Tone and contraction is the same word. We will use tone, muscular tone, this, that. Contraction and tone is the same thing. So constipation, heartburn, and varicose veins, who's responsible for them? Progesterone. Okay. Now, estrogen suppresses follicle stimulating hormone and luteinizing hormone. And what are these hormones? These hormones are important for ovulation. And why do you need these hormones? Why do you need these hormones? Because they will help in producing the ovum. Okay. So we don't need them during pregnancy. That's why estrogen will suppress them, because you don't need them. Aids in growth of fetal organs, maternal tissue growth. Which tissue growth? Breast enlargement, genitals, all those growth is related to estrogen. Okay. Anterior pituitary stimulates the thyroid gland, increases mom's metabolic rate, increases appetite, increases metabolism. I have to let the student in. Okay. I'm not saying remember everything, but I do want you to focus. Okay, that pay attention to a little bit, because these things I'm going to repeat everything again, but I want you to pay attention that these progesterone and estrogen, you need to know broadly what is the function. Estrogen for breast enlargement, E for estrogen, E for enlargement. Okay, progesterone maintains the pregnancy. So P for pregnancy. Who helps in maintaining the pregnancy? Progesterone. Why? How can you maintain a pregnancy? You have to cause no contractions. Okay. So progesterone relaxes everything. So you have heartburn because the lower esophageal sphincter is relaxed and the acid is coming up. Okay. We will talk about that too. Circulatory, increase in blood volume by 1 to 2 liters for the baby. Decrease in blood pressure and heart rate increase. We will talk about all these because I have more slides to talk about them, and I will explain more. Growing uterus and body, compressed pelvic blood vessels, and varicose veins is common in pregnancy. Prolactin, if you think about lactin, think about lactate. Prepares breast for lactation. Think lactate. Okay. Now, skin, you all were, when I initially started, you all were talking about the skin, right? Like skin, what happens. Striae, we will be talking about them. Stretch marks. And, you know, I hear this a lot. Can we give the patient shea butter or something to prevent the stretch marks? Like NCLEX has asked this question in the past. Raise your hands if you think yes. Tell me yes or no. You can write in the chat too. Reeve. Can we prevent stretch marks? Your hands up. Okay, I have Ishi. Oh, I think I have in the chat. No coconut oil. Gurpreet, when you say coconut oil, you think it can prevent the stretch mark? Lots of no's. I like it. I'm happy about that. I can't hear you, Reeve said. Can anyone else not hear me? Can you guys hear me? Can you guys hear me? You guys are just nodding. How do I know you can hear me? Say yes.
Yes, ma'am. Yeah.
Yes.
Okay. Reem, I think check the volume on your thing. Okay, you guys are doing this. I sorry?
Yeah, you too.
Sorry? Everybody can hear me?
Yes, ma'am.
Okay, perfect. Thank you.
Yes,
Okay.
ma'am.
The stretch marks are genetics. If your mom had stretch marks, there is a very high chance you're going to have them. Nothing can prevent stretch marks, but using shea butter, coconut oil or something is good because it will moisturize the skin. Okay, that is the only purpose. But can it prevent like all these big companies selling all these products? That's not true. You can never, prevent stretch marks from happening. Okay. Linea nigra, linea is line and nigra means brown pigmentation along the stomach. I will show you pictures. So it's like the line in the middle, the vertical linea nigra. Okay. Oxytocin, what is that? When do you hear about oxytocin?
During labor time.
During labor time. So what do you think oxytocin does?
Initiates
Contractions.
Contractions. Oxytocin is for contractions. So causes contractions, but is inhibited by progesterone. What's the function of progesterone? Relaxation. So oxytocin and progesterone work in opposite direction. Oxytocin causes contraction. Progesterone causes relaxation. So during pregnancy, progesterone takes over because we want to maintain the pregnancy. We don't want the uterus to contract because otherwise it will lead into miscarriage. Okay. So aids in milk ejections during breastfeeding. Okay. So health checkups during pregnancy. First visit, as soon as the woman finds out she's pregnant. And when can she go? She thinks what? Oh my God, I have amenorrhea. My breast is tender. I am so tired. All the presumptive signs. And maybe she did one probable. Which one? Her home pregnancy test.
Urine.
Yeah, home pregnancy test. Okay. 6 to 8 weeks, it's first prenatal visit and it's extensive. When we say extensive, you also have to realize, don't think about your own culture, like who smokes, nobody is into drugs. People do. Okay? People do drugs, people smoke. So there are questions that we ask. There are sexually transmitted infections. We do the urinalysis in the first trimester, like first visit. The doctor is going to do you guys remember any of the tests that the doctor has to do during the first visit? Like they are like, oh my God, we need to do all these tests. Anyone remembers any of those tests? So I have Ishi, your hands up. Good. Okay, Ishi, tell me, what do you think?
HIV test.
HIV, yeah? Sexually transmitted infections. I need to know, like, why do we need to know HIV actually? Like, why is it so important? I have Shalu, why?
Transmitted children. Because it will be transmitted from mother to the child.
Okay. So, like, another question that I have for you guys. Any baby born to an HIV positive mother, are they gonna be HIV positive for sure? Is that like, it's gonna happen no matter what you do? Or can you prevent the transmission? Kulbir,
During birth.
Kulbir?
Breastfeeding.
Yes, ma'am.
What are you saying? What's your answer?
Yeah, ma'am. HIV diseases transmit through placenta to baby. I think it shows it's transmit.
Shalu? What do you think, Shalu?
Yeah, it is transmitted like during delivery time also. It can also affect to the nurses and the doctors also. So we have to prevent all these things.
Okay, so some of the things I'm going to tell you, some of the concept you have to unlearn, and this is one of them. Okay, you can prevent the transmission. So NCLEX is going to ask you, because they know you're thinking HIV, what kind of precautions do you need for HIV patients? One of my students got this question. What kind of precautions? So I'm very interested to know, what do you guys think? Okay, those are the two hands I am seeing a lot, and I like it. Sukhveer, please don't draw anything on my screen. I see you hovering around, but okay. Nobody else? What kind of precautions? NCLEX love, infection control. One of my students who passed this morning, Manvi, she was telling me, she's like, ma'am, I got 3 questions straight from infection control, and I already, I didn't even spend 20 seconds. She's like, I didn't even read all the options because I knew. So, Sarnia, what do you think? What kind of precautions for HIV?
Standard
Need to
precaution.
take antiretroviral.
No, my question is, so see, this is another thing you guys are learning. Listen to the question, pay attention to what the question is asking. Pearl, what's my question and what's the answer?
So what kind of precaution needs to be taken for HIV? I think it's droplet
No.
because
Oh my God, guys. Manya.
It's due to blood contact, so we need to wear gloves, gowns, and all, so that to protect.
Ishi, your hands up. Yes. No? Okay. All right, that's your, assignment to get it for me tomorrow, because somebody got Annapurna. Annapurna, I think you probably know. What's the answer?
Actually, HIV is a sexually transmitted disease. So,
So when you guys tell me, when I'm asking you a question and you're telling me, I have people in the waiting room. Give me a second. So when you guys are telling me, I'm asking you, what kind of precautions? Who am I talking about? The nurse, the doctors, right? And you guys start your answer with, it's a sexually transmitted disease. That's not a concern for the doctor or the nurse, right? That's right.
Yeah.
Okay, Binder, you want to, are you able to answer, or are you gonna? Mandeep, standard precautions. Okay. So students who have written the standard precautions is actually the right answer. Okay. This is your first unlearning today. You guys can do more research and find out. And you will know, we wear gloves for any type of contact. If it's wet and not yours, you wear gloves. If it's going to splash on you, you wear a gown. Okay, even if the patient does, if I am doing a wound dressing and I know it's going to splash too much, I'm going to wear a gown. It doesn't matter what kind of precautions the patient has or not. I'm going to protect myself. So anything that is wet and not yours, personal protective equipments. Okay, so we will be talking about that too, and we will do a lot of questions on that. So I'm just going to keep moving because I have so much to teach you, and we're going to learn as the time goes. So first 28 weeks, once a month, the mother should visit the clinic once a month. We will be taking history in the first prenatal visit. We will be asking about the weight, the nutrition, exercise, over-the-counter drugs, herbal medication, illicit drugs, any allergies or potential teratogens. Okay. History of any sexually transmitted infection, diabetes, renal, thyroid, gynecology history, pap smear, previous infection, all that. Okay, so that is done in the prenatal visit. And one of the very important things that we test in the prenatal visit is blood group. And why is that important? Why do you need to know the blood group of the mother and the partner?
It's for RH incompatibility.
RH incompatibility. And when does RH incompatibility happen? When the mother is negative and the father is positive. There is a 75% chance that the baby is gonna be positive. So mixing of blood can cause RH incompatibility. Who is at risk? The second pregnancy, the baby is at risk if the mother is sensitized. And it's known as what? Maternal sensitization. We will be covering RH incompatibility in detail, and I will take all the questions. There are so many points where you have to give RHOGAM to the mother, even before the delivery, if certain procedures are done. 28 to 36 weeks of pregnancy, the mother should visit the doctor every 2 weeks, 36 to 42 until delivery every week. Okay. Next is Nigel's rule. You can call it Nigel's rule, whatever you want to call it. There are key points about Nigel's rule. estimate an expected due date based on the first day. So I am highlighting something. First day of mother's last menstrual period. So based on 28-day menstrual cycle, and it's just an estimation. It's not like written in stone. Who is the best to tell you the expected date of delivery? What is the best way to know? Somebody raised it.
Ultrasound.
Ultrasound. Ultrasound is the best way. And another thing I want you to remember, so you know how it's written 40 weeks. 20-week period is a very important period throughout the pregnancy. And you will see, if you remember this, that 20 weeks is important. So many preeclampsia, you know, we do gestational diabetes testing, glucose screening. It's done at 24 weeks. So 20 weeks is what? The middle of pregnancy. Anything under 20 weeks, the terminology, if the mother loses the baby before 20 weeks, it has a different terminology versus if she loses it after 20 weeks. So please keep 20 weeks in mind because the pregnancy is considered to be 40 weeks. 20 weeks is halfway point. Okay. So women vary in cycle. It's just an estimation. This is from Stephanie Begg's slide, Nigel's rule. What is it? Calculation used for estimating the expected due date based on women's last menstrual period. And what is she missing? First day of the last menstrual period. Okay. Does not count for leap year. So it doesn't matter if it's a leap year or not. Like, don't focus on that. Average pregnancy lasts 280 days, 9 months, 40 weeks. In nursing, we don't go by months. We care more about weeks, 20 weeks, 24 weeks, 28 weeks. So we always have to, don't ever get into the trap of months. I know, like in layman terminology, it's all about months, how many months, how many months. But in nursing, in medical science, what's important is weeks. Okay. So 28, think menstrual cycle is measured by 28 weeks, 40 weeks, I already said. So you can remember first trimester means first 3 months, 12. Second trimester starts after, and this is the third trimester. So 3 months every trimester. Nigel's rule is actually 2 ways to do it. My next slide will explain it. This is from Stephanie Begg's slide. So as I said in the orientation too, I like Stephanie Begg's, Christine Pearson, but there are some things I like to do differently because I'm not 100% with their ideology, what they have. So she's saying that it's always minus 3 months plus 7 days and 1 year. Now I am saying, what if the baby is born, like what if the LMP was February? Would you still add a year? No, right? Do you guys agree with me? What if the LMP is in February? Will the baby be born in next year? No, that baby is going to be born in November this year. So I don't actually agree with everything they say, but then I do my own work, right? So Nigel's rule, well, when LMP is from January to March, for the first 3 months, when would the baby be born? Even if you add 9 months, whatever rule you use, the baby will be born in the same year. You never have to add a year. Don't ever trip on this, okay? Pay attention. This is about attention. We don't have to remember the rules or anything. January to March. If somebody has last menstrual period on January 10th, if you add 9 months, when would the baby be born? When is the baby going to be born?
September.
September.
October.
October. Go by numerics. January is which month? First. 1 plus 9 makes it 10th. What is 10? October. Okay. Confuse yourself. March. March is 3. 3 plus 9 is 12. 12 is what? December. Okay. So add 7 days to the LMP. First day of the LMP, add 9 months. For January to March, this is the formula we're going to use. We're just going to add 9 months, 7 days, 9 months. No need of adding a year as the baby will be born within the same year. When LMP is from April to December, subtract the 3 months, add 7 days to LMP and add 1 year. Baby will be born next year. Okay. Anytime the days are 30 plus, it will go to the next month because a month can only be 30 days. This rule is just an estimation. We will do questions and you will see what I mean. Okay. All right. So if you see January 5, when is the baby going to be born? October. Okay.
October.
So 5 plus 7 is 12. 12th of October. Which year? 2017. Is that right? Hey, Now let's do a question together. September 28, 2016.
June 28, 2017.
No, it's July 5,
July 5th.
2017.
July.
July 5 or 7.
Okay. Some people are saying June, some are saying July. Why? Okay, let's do it together.
28.
So September, which is the formula? +7 -3 +1,
-3
right?
+1.
Because add 7 days. So another thing I want you to remember, always do the months first. Do the months first, okay? So September is which month?
9 months.
9 -3 is 6,
6.
right? So technically June is the 6th month.
Yes.
So okay,
Yes.
like I am here at June 2017 is my, I'm gonna look for those. Now if you're at 28 +7, what does it make? 35. Can a month have 35 days?
No.
No.
So the 5 days will go into next month. So what is the answer?
month.
July.
5.
July.
2017.
Does that make sense?
Yeah.
Okay. Always do the month first to avoid the confusion. So I think I posted the questions in the chat. So let's do the first one. LMP May 21st, 2016. We'll do a few of them. I'll send you the rest of them. And there will be a break at 7:30. I'm doing question 2 because I forget the answers too. So I'm just gonna do it. So May 21st, 2016, what's the answer?
It's February 28, 2017.
2017 is the right answer. February 28, 2017 is the right answer. And Riddhi, how did you get February 28, 2017? I think I should pin the message because you guys will lose it. What do I do?
I have added nine. I have counted 9 months from May,
Okay.
and then added 7 days to date 21.
Okay, so you can
20.
do whatever works for you, but my recommendation is January to March, add 9 months. After that, subtract like the 3 months because it's easier. You will realize it. And months, always do the number minus the number. It will give you the right number all the time. If you, so the question was, what was the question? May 21st, 2016, right? So 21 plus 7 makes it 28. May is which month? 5th. Minus 3, 2, which is 2. February. Plus, because it's May, so plus another one. Let's do the number 2. November 25th, 2016. Okay.
September 1st, 2017.
Okay, and some of you are writing September 2nd. Pearl, explain me, how did you get September 2?
Oh, sorry, I didn't count. It was 31 days. September 1 should be
Yes,
the right.
very important. You need to know how many days does the month previous to it has. Right? You have to give, so if it was 35 July, you would minus 31 days. So just for example, if it was 35th of July, what would you do? You will minus how many days that July has? 31. So it will be 4th of, like, I'm just giving a random example, okay? So make sure August has how many days? 31. How do you count these? January, February, March, April, May, June, July, August. 31. Everything that comes on top of your knuckles. So Srushti, did you just understand? Dheeraj, you wrote September 2. Did you understand what happened? Very important, and NCLEX will trick you on that. Okay. Okay. I'm going to give you another one. August 28, 2016. It's not there, but do this one. August 28, 2016. Question is August 28, 2016.
By May. 4th June.
Somebody was saying the answer.
May 4, 2017.
Sorry, somebody said
May 4th.
May 4 is not the right answer.
May 3.
June 4, 2017.
June 4, 2017
June 4, 2017.
is the right answer. How? How did you get this answer? June 4.
First, we subtract August month from 8. It's the 8th month minus 3.
Month is
That becomes
8 minus 3 makes it what?
5. That is
5.
May.
And then what
That
did
is
you
May.
do?
Then it's August 28. The number is 28. So we add plus 7.
7. It
So
makes it
or the
35.
August.
Yeah.
Yeah.
And
the
how many
August has
days?
31 days.
Sorry?
August has 31 days.
Sorry, I missed you.
So then we add 4 on the next month. That is
Parul, you got the answer too, right? How did you get the answer? Shalu, how did you get? Wait, Shalu, how did you get the answer?
In August we have like 20. The August is
31st.
So please explain me, guys. How did you get that?
August is 21 days.
Wait,
and
I'm just
then-
gonna. So you guys are stuck with the August. Why are you stuck with the August?
May has 31 days. So that's why we are.
So you are focusing on what month did you get versus what month you are counting. Okay, so I'm just gonna do this one and then I'll take you to the next slide and explain what is it. I'm just deleting the things that I just, okay. So September 28th, 2016, right? This is one of the questions that you were doing. LMP plus 7, what does that make? LMP plus 7 will make it 35.
28%.
Right? This is the answer you guys did. So focus on what are you focusing on? 28 plus 7 makes it 35. 30 plus 5, because otherwise, how many days June has? 30. So the 5 days will go into July. This is the same question we just did. So what are you focusing on? When you subtract the months, that's the month you are concerned about. That's the month you need to count how many days that month has. Okay? Let me show you another. Okay, so let me just draw it for you guys. What was the question? August 28, 2016. Okay. Everybody write on your notebooks. We are doing this together. So what are we first gonna do? What is the first thing? We wanna subtract August is 8 months minus 3.
3.
What is the answer? 5. Which month is 5?
May.
May. Okay, so 28 plus 7 makes it
35.
35. So how many days May has? January, February, March, April, May. May has how many days? 31.
31.
35 minus 31. What is the answer? 4. 4th of what?
June.
2017. Does that make sense to everybody?
Yeah.
How did we get June? Is that what your question is?
Yes, ma'am.
Think about it. You got May. Did you get May? Did you guys get May though? Like you got
Yes.
you got May, right? So May has how many? So look at this picture. Can you see? Forgive me for my handwriting. So look, 8 minus 3 is 5. 5 is May, right? And 28 plus 7 makes it 35. But how many days May has? 31. So you minus 31 and 4th. 4th of which month? 4 days will go to the next month, which is June.
June.
Does that make sense to everyone?
Yes.
Okay. Give me a second. I'm just gonna move forward. I hope it's clear to you guys. It's very important because I know sometimes students are so confused and they're like, oh my God, I don't understand it. I hope it makes sense to you now. Okay, I have somebody in the waiting room. Okay. So next, gravidity, parity, GT, PAL, and practice. Important, confusing. I understand that, but I'm here to help you. So gravidity is the number of times a woman has been pregnant. So gravid is like gravid uterus. You got pregnant, no matter what the result was, you were pregnant. Make sense? Okay.
Yes.
So key points, the outcome is irrelevant. It does not matter if the baby was born, not born, abortion, whatever. You were pregnant means you were pregnant. Okay. So somebody who had an abortion at 16 years old and now she's 29 and she's pregnant, she is gravida too. Why? Because the first time she was pregnant. So gravidity is related to the uterus. When did the uterus actually ever got a baby inside? Okay. So that is what gravida is. Outcome is irrelevant. It's very important that you focus on these words. It does not matter the status of the baby. We are counting solely pregnancy. Solely pregnancy, only pregnancies. So solely is not just like a scientific term or anything. It's just talking about that you're just focusing on the pregnancy. This includes current pregnancy, and NCLEX will trick you on that. They'll say the female is currently pregnant. What is the gravidity? Does that make sense? You have to count that. We are counting only pregnancy, not the number of babies. What does that mean? If the mother is pregnant with twins, it still stays one because the uterus, we're talking about the uterus. Is the uterus pregnant? It doesn't matter if the uterus has twins in it, triplets in it, quadruples, anything. Uterus is pregnant and gravidity is one. Okay, so twins, triplet are not related. Next is parity. So there are two systems like to record this. The one you're talking about, parity is about what was the outcome, what happened to the baby, when was the baby actually born, and then we divide it in term, preterm, abortion, and living. That is what exactly parity is. Okay, so number of times mom has given birth to a baby, that is what parity is. Did the mother ever give birth to the baby more than 20 weeks? This includes all the babies who are more than 20 weeks. What is 20 weeks? Did I say 20 weeks is important time? 20 weeks is halfway through the pregnancy.
Half of pregnancy.
Okay? So any baby who was born after the 20 weeks, living or stillborn, is a parity. Okay? We are counting only pregnancies, not the number of babies. So pay attention. Next slide is going to be more clear. This is Stephanie's slide, so it's a little different. Recording GP system, G2P1 or G1P0. There is a 5-point system too. So this is 2-point. Gravidity and parity is 2-point system. What does that mean? Gravidity means what happened to the uterus. Is the uterus pregnant? Has the uterus ever been pregnant? Does not matter how many number. Parity. How was the baby born after 20 weeks? Was the baby born? Was the baby about? Like, it doesn't matter what happened to the baby, but was there any deliveries after the halfway point of the pregnancy will count as parity. Okay. So gravidity, same as above. Term birth is 37 weeks is your term. 37 weeks is the time when the baby can come out and is okay because they have fully grown. Okay. Preterm is 20 to 37 weeks. Okay. 20 is what? Halfway. 20 to 37 is preterm. Abortion or miscarriage, any baby that was born before the 20 weeks gestation, which is halfway of the pregnancy, is considered abortion or miscarriage. Living children, all children will count individually. If there were two children like twins, then the only time you count the living children is at L. Okay. I'm not going to do this because I have my own questions, but you guys can do it when you get a chance. So this is more cooler than like what Stephanie has. So gravidity, a woman who is pregnant and number of pregnancy, and you have heard these terms. Nulli gravid means never been pregnant. Primary gravid means first time. Multigravida, more than two or more.
Two or more times.
Parity. What is parity? We just talked about parity. The number of pregnancies that have reached viability. What is the point of viability? 20 weeks. More than halfway through is viability. When the baby is viable. Maybe if the baby is born after 20 weeks, you can make the baby survive by artificial mechanisms and everything. But before 20 weeks, it's too hard. Okay, so this is known as point of viability. Viability is the term for what? you can make this baby viable. Okay. So nullipara means 0 pregnancies that have reached viability. Okay. 1 pregnancy that has reached viability is primipara, multipara, 2+ or more pregnancies that have reached viability. Okay. So GTPAL is an acronym. Acronym means every letter, same like presumptive. Acronym means every letter has a meaning. Okay. So you just picked the first letters, but they have meaning. So gravidity, number of pregnancies, includes the current pregnancy. NCLEX is going to test you on this thing. They are so mean. They are so mean. Okay. Includes the present pregnancy. It also includes miscarriages and abortions. Because what happened? It was gravid. There was a baby in the uterus. It doesn't matter what happened. Twins and triplets. So you will notice one thing. I'm going to highlight it. Twins and triplet count as 1. 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 Except in the living number of children. Do not get confused. Term, what is the term? Definition of term? More than 37 weeks is term. Okay, good. So number of newborns born at or more than 37 weeks of gestation. Preterm, 20 to 36.6. What is the meaning of 20 to 36.6? 20 weeks is what? Point of viability, halfway to 36.6. 36.6 means 6 days out of the week, because otherwise if it becomes 37, it will be term. 36.6 means 36 weeks and 6 days. 1 day short of the week. Okay. Abortion, what is the meaning of abortion? The number of pregnancies delivered before 20 weeks of pregnancy is known as abortion. Very important term, it will come. Any baby that was delivered before the period of viability, before the halfway point of the pregnancy, goes under abortion. Okay. So counts towards gravidity, the number of pregnancies, twins, triplets count as 1. Living children, the number of current living children, twins and triplets, are counted individually. Now I'm not gonna show you yet. Like, how do I do that? Give me 1 second. I just don't want anyone to cheat. So there is a question underneath. Let me just hide. Okay, so I think I'm good. I can just, okay. So let's do the first question. Can anyone read the question for me, please?
Can you please zoom it, ma'am?
I will.
Oh, sorry.
I know. Like my vision is as poor as it can be. So we're just gonna do one from here and then we'll go. Okay. Who's gonna read it for me?
You are admitting a client to the mother-baby unit. 2 hours ago, she delivered a boy on her due date. She gives her obstetric history as follows. She has a 33-year-old daughter.
Wait. Not 30. Not 33.
She has a 3-year-old daughter
3 years.
who was delivered.
So, Cynthia, hold on. Reading the question is a skill, and you guys are going to learn it with me, because I will ask you guys to read the question. Can I read the question? Absolutely, I can, but that's not the point. You guys got to learn how to read questions which are like so wordy, because that's what NCLEX is about. So everybody should learn to pay attention to the screen and read the question for themselves. Cynthia, go ahead. Now read it again from the, she has a 3-year-old daughter who was delivered a week. Yeah, you can go ahead.
She has a 3-year-old daughter who was delivered a week past her due date, and last year she had a miscarriage at 8 weeks gestation. How will you note this history using the GTPAL system?
Okay, you guys go ahead, do the question. I want to know, what do you guys think?
Can you please go up the screen?
Sorry?
Use the GTPAL. Go up.
Go up? Okay, but like
zoom out.
I think I don't want to zoom out too much because I don't want to give you guys the answer. Give me 1 second. I can go to the previous screen if you want. Give me 1 second. Maybe that will help you. Is that helpful? No, you guys want the same screen? Okay,
No.
let me just do it for you. because I don't want you guys
the
to miss.
last option.
Sorry?
We can't see the last option. What's the D written option in D? Option D.
On the screen here, 32012.
Yeah.
You can
Only
see.
3 options are there, or D was also there.
So A.
I can't see the D option.
Anyone else can see? Jado, can you see the D?
Yeah.
Yes.
Yes, we can
I
see.
think, Mandeep, it's to do with your screen. You're gonna have to fix that because it's on the screen.
Just scroll down.
Sorry? Pravinder, okay. All right, what's the answer? I'm gonna try to.
D.
Sorry?
D. Option D.
D. D, okay. All right. Who all got D? Parul got D, and one other person, Annapurna got D. Okay. Kanchan got D. Okay. Anyone who did not get D, please tell me that if you did not get D. Okay. So you are admitting a client to the mother baby unit. 2 hours ago, she delivered a boy on her due date. She gives her OB history as follows. She has a 3-year-old daughter who was delivered a week past her due date. And last year, she had a miscarriage at 8 weeks. So when you do GT PAL, I want you to write on your notebook. How much is her G? She has a baby boy. 1, she's pregnant now. Then she has a daughter. 2, and then she had a abortion,
Miscarriage.
gestation. So what is my G?
3.
3. I'll eliminate option 1. Can I? Because it says G2, that's wrong, right? Term. What is the meaning of term? Any baby born at 37 weeks gestation and
40.
after that, right? So the baby boy is delivered on the due date. When was her daughter delivered? 1 week past her due date. Okay, still term after that. Now, is there any other baby who was born? So if you look at the options, all of them has 2. So you don't have to waste your time on term anymore. Make sense? Option A is eliminated. Everybody has 2. Now look at the next part, which is what? Preterm. Preterm means, did she ever deliver a preterm baby?
No. 0.
No.
No. Okay. Did she have an abortion?
Yes. 1.
Yes.
8 weeks. And why is it 8 weeks an abortion? What if it was 21 weeks? Where would you write it?
Preterm.
Preterm. Good. That's good. And living, how many children she has now? 2. So you will easily eliminate option A and B, and you only have to think about C and D. Does that make sense? You need to learn these rules. Don't waste your time too much. Learn it. What can you eliminate? Okay. We're not going to do the other question because I have more questions for you. Here, I'm just going to bring it back. Let me. Okay. A patient is pregnant with twins at 30 weeks gestation. This is her first pregnancy. How would you calculate the patient's gravidity and parity? It should take you 1 second to answer me this question.
G1,
G1P0. G1P0. This is her first pregnancy. She's never given birth. Parity is about giving birth. She's never given birth. So G1P0 is the answer. Right? All right. Dheeraj, can you please read the question?
During an assessment of a pregnant patient who is 20 weeks pregnant, she tells you the following information regarding her pregnancy outcomes. She currently has 3 children, ages 3, 8, and 19. All of them were born at 39 and 40 weeks gestation. She has been pregnant 5 times, including this pregnancy. How would you document her GTPAL?
That's good. Thank you. Learn the rule of elimination. What is 1 point? What one option, like the options that you can eliminate without even thinking? Which ones are you eliminating?
2 and 3. 2 and 3.
2 and 3.
2 and 3. Why? Because how many times has she been pregnant?
Five.
Five times. So this
Five
is
times.
wrong. This is wrong. What do we have to focus on? 1 and 4.
One and two. One
How
and
many children
four.
does she have living?
Three.
Three
Three.
What is the right option?
Option one.
Option
You
one.
didn't have to waste your time. No, right? You didn't even have to waste your time. Why? Because you use the rule of elimination.
Elimination.
Now you can spend 2-3 minutes on it, no problem. But you gotta be smart. That's what NCLEX is all about. How much time are you spending on this question? I could have made you spend 2-3 minutes. Absolutely. You can, even if you want to do it, you can absolutely do it. But I'm telling you, because the question is clearly telling you she currently has 3 children, 3, 8, and 19. That means they all are living. Good. I don't have to go into TP or something. All I have to care about is this is L3. Okay, 3 living children. G5. Okay. Other options don't meet the criteria, so they are all wrong. My option 1 is right. Manya, your hands up.
I just wanted to ask about the parity. Does that mean the child is just like died before like 20 weeks, right? Not
So
it's like not about giving birth.
it's the birthing history parity. So gravidity and parity is a different, it's a 2-point system, and GT-PAL is a 5-point system. Okay, so gravidity and parity, that's a different terminology. These are 2 different systems used in obstetrics. Mostly 5-point system is the one which we normally use because that gives you more details, right? Parity only tells you that, yeah, there was a birth after 20 weeks. But if you do GT-PAL, it tells you exactly how many children were born at term, preterm, and how many were aborted. It's just 2 different systems. So that's what it is. Does that answer your question, Manya?
I just want to know that parity exactly means like a child that's having a stillbirth or like miscarriage, something like that.
So it's all about the number of weeks. It's all about that, okay? So the number of pregnancies that have reached viability, whether the fetus was born alive or not, it does not matter. It doesn't matter if the fetus was alive or was dead. It's only about how, at what time. So timeline matters. When did that happen? The baby was dead, alive, doesn't matter. But when did that happen? Did that happen after 20 weeks? It will be counted as parity. Okay. Farrell, your hands up.
Yes, I have a question. So the H-mole would not be counted as any of the pregnancy, right?
It will because molar what? Pregnancy. Molar pregnancy. As soon as the word ectopic will be counted as gravida too, because it's still a pregnancy. Ectopic pregnancy. As soon as the word pregnancy is attached, it becomes gravida. Okay. Doesn't matter what is the outcome, what is happening. It will be counted. Good question. Very good question. Please pay attention to these kind of questions. That's what I mean when I say you got to learn from your peers. Okay. We're going to do this question and then we're going to head out for break. Okay. Jaswinder, can you please read the question for me?
The nurse is assessing a client who gave birth to twins at 31st weeks of gestation and to a stillborn infant at 23 weeks of gestation. 1 year later, she had a spontaneous abortion at 12 weeks of gestation. She is currently pregnant at 25 weeks of gestation. It would be correct for the nurse to document this client's GT-PAL as.
All right. So I think I'm going to leave you guys with this question and come back after the break and find out the answer, because maybe you should spend your time on the question. Okay. Are you guys feeling confident? Are you feeling good about it, that you can do it?
Yes.
Yes. Yes, ma'am.
Yeah. Okay. Anyone has, like, I'm going to still do the question with you. I'm just kidding. Anyone has a question about this part? So the nurse is assessing a client. Srushi, your hands up.
Yes, ma'am. In last question, why A1? Because of 20 weeks pregnant?
Sorry. No. That is like she's currently pregnant. So that means if you count 5, she's currently pregnant. That's a good question too. I'm great you brought it up. So 3 kids are born at term. There is no preterm, right? So what would have happened to one child that she's not telling you? It's 1. Do you know what I mean? So gravida is 5. How is the gravida 5? Because she's been pregnant 5 times. Okay. Out of 5 times, she already has 3 kids. And 1 is right now. Where did the last one go? Where is the last one? She has 3 children.
She is pregnant.
1, she's pregnant right now. What can you assume? That must have been aborted. That's why there is 1.
Abortion.
Not every patient. Very good question, Srishti. Not every patient's gonna tell you about abortion. You have to figure it out sometimes. Okay. Here we are not assuming, but we know that she's telling you the outcomes of her pregnancy based on whatever information we have. That means that one of the child, because she doesn't have a preterm baby, like we don't know where it, like it will only fall under abortion. So usually when you have G5, you know that she has 3 living children. So definitely they were born. 1 she's pregnant right now. Where is the other one? How is she have 5? 1 is missing. Okay, Manya, your hands up. Shushi, did I answer your question? And it's gonna happen in the exams too. Manya, do you have a question?
Yes, I have. Like, can we go to like question 2 where we were like talking about twins and 30 weeks of gestation?
This
I'm
one?
legit
This
confused
one?
about this. Yeah,
This one?
it should
Okay.
be like G1 and P1, not because parity is like 22 to like.
So the baby is not born yet. Parity is decided after the baby is born. Make sense? Whether
It's
the
not
baby
like
was
the
born.
parity is not about like.
Sorry?
Parity is not like reaching at viability. Like,
Not just that. No, how the baby was, when was the baby born? That is parity.
that's okay.
So the number of pregnancies that have reached viability, whether the fetus was born alive or not. So it's related to if the fetus is actually born alive or dead, it doesn't matter, but it will be parity is related to timeline plus the birth. So parity is the birthing history. When was your baby born? Was the baby born at what time? Was the baby born alive or dead? That is what parity is. Okay. Not just because it's 30 weeks gestation, parity should be 1 or 2. No, that's not the question. The question parity is related to the birthing history. Birthing history means when was the baby born? Alive or dead? That's the outcome. But when did that happen? Timeline. Is that like, does that help you in answering the question?
Yes, thank you.
Yeah, you're welcome. So let's just do this one too before we go for break. Give me a second. I just don't want you guys to see the. Is my pen working? Okay, so we're gonna do this question too, like practice question 2. And I'm gonna zoom it. Okay, can you guys read this question? So I'll read it for you before we head for the break. A prenatal client's obstetric history indicates that she has been pregnant 3 times previously and that all her children from previous pregnancies are living. 1 was born at 39 weeks gestation. Twins were born at 34 weeks gestation and another child was born at 38 weeks gestation. She is currently 38 weeks pregnant. What is her gravidity and parity using the GT-PAL system? Okay, so try to use the rule of elimination if you can, and then try to do this question for me. So what is our gravida?
4.
Of course, there's no other option. So 4, we're not going to waste our time. It's 4 because every option has 4. Because she has been pregnant 3 times and now she's currently pregnant. So how much is gravida? 4.
4.
So 1 child was born at 39 term. Twins were born at 34. Is 34 term?
Preterm.
Preterm. So how many preterm? What would you write under preterm? 1 or 2? Because it's twins.
2. If it's born 2.
1.
1.
Because what did I teach you? You guys are missing something. Everything is 1, 1, 1 until you count the living children. Until you reach the L, everything is counted as 1. So even if the twins were born preterm, what would you count them as?
1.
Why would you count them 2?
1.
Option C.
Oh, no, that 30. 34 weeks. Oh, sorry.
That's okay. Another child was born at 38 weeks. She is currently 38 weeks pregnant. So what is her
Option
G?
C.
G is gravida is 4. All of them has 4. T is term.
2. 1.
2.
She has.
2.
How can it be 1? Like, what is causing the confusion? Why are you guys confused between 1 and 2? Why? Term. How many kids are term?
2.
2.
But every kid is everything is counted as 1. Twins, triplet as 1. Let me just zoom it out for you. Then it will help you. Like, look at that. So gravidity, term, preterm, abortion, living. Only living you count the triplets individually. Rest everywhere it's counted as 1. Even if the twins are born at term or preterm, they will be counted as 1 birth. They were born at 1 birth, at 1 occasion. Okay. So what options are you eliminating? Option 1 and option 2, because that's term is only 1. How many kids are born at term?
2.
3.
2.
39 and 38 weeks.
That's actually right. The 3 were born, but how many are we counting?
2.
2. Okay. Okay. Next is GTP. P is what? Preterm. Now preterm is
1.
1.
1.
1.
Did she ever have an abortion?
No.
No.
How many living children does she have?
3.
4.
4.
4. How does she have 4 children?
Yeah, 4.
1 was born at 39.
One
She's
was-
been 1. 2 twins are going to be counted in the living. So 3 and another child 4.
4.
Does that make sense?
Yes.
Yes.
Practice more questions. We'll be practicing more questions and it will hopefully make way more sense than this. Okay, so I'm going to give you guys a 20-minute break and then let's just come back. Are you guys bored enough with me? Are you done?
No.
I know, I'm pretty cool. Anyhow, let's take a break of 20 minutes and let's come back. And I hope that we can continue to learn some more cool stuff. We're going to do a question in the end.
But the answer is C, right?
What do you think?
Yes, C.
You should, like, I want you guys to be so confident that don't even question yourself again. Look at that. You guys did it yourself, right? So as soon as you understand the concepts, that's it. Don't try to remember. You do need to know the gravity term. I have already pointed out the things that NCLEX can trick you with. Currently pregnant, twins are some of the terminologies they will trick you with. But you know, you're not going to count any twins or triplet until you reach L. Okay? Because L is when it matters the most. Okay. All right. So let's go for a break. Good. Okay. So let's come back. It's 7:40. Let's come back at 8 and start again. Good. Okay. So I'm just gonna pause the recording because I usually forget the record. Okay. So how many of you have done this question already? I see Manya G40. Okay. Mane, your answer is like there is no slightly wrong. It's like wrong is wrong, even if it's by 1. So I want to know what you guys have as answer. Astha G4T0 P2 A1 L2 G4T0 P2 A1 L2. Astha, your answer is right. Okay. Anyone else have the same question that I can just like we can just talk about it? Let me see if I can share my whiteboard. Where's my whiteboard? Then I will not have the question. Okay, are you guys back? I'm not sure if students are back.
Yes.
Okay.
Yes.
Okay, perfect. Thank you. So How many of you have gotten the answer? I see 3 charts. Okay, G4T0P2. P2A1L2. So G4T0 P2A1L2 is the right answer. So Parul and I think Asta has. Yes, I got it. Okay, Mane, did you get what was wrong?
Yeah, I got, because I didn't count for the preterm of the twins as 2. I got it.
Yeah. Okay, perfect. Okay, so let's do it together. G. So I usually like to write it like this, GT pal. And count it like lines, okay? I don't know what they call them. So the nurse is assessing a client who gave birth to twins at 31 weeks of gestation. So 31 weeks is still like a pregnancy. Stillborn infant at 23 weeks, another pregnancy. 1 year later, she had a spontaneous abortion, another pregnancy, and she's currently pregnant. 4. Are we good? Everybody understands that?
Yes, ma'am.
Yes.
Yeah. Okay. Now we are looking at term. What is term? Term is
Fully term. More than
37 weeks
37
and
weeks.
above.
37 and more.
More.
Okay, that is
Till
term.
for our life.
What is preterm? 22.
22 to 37.
0.6.
22, 36 weeks.
0.6. Okay. What is abortion? Anything less than?
Less than
20th
20
week.
weeks. Okay, so term. How many kids are term? Is there any kid? 31 weeks.
No.
Is it term? No.
No.
23 weeks? No. And then you have an abortion at 12 weeks? No. And she's currently pregnant, so that does not count. That only counts towards gravida. So term is 0. How many preterm?
2.
31 weeks and 23 weeks.
23 weeks.
Become para 2. How many abortions?
One.
One.
Because it's
12
less
weeks.
than. So
20.
induced, even if the doctor induced the abortion or it's spontaneous, it happened naturally, it will still be counted. How many living children does she have?
2.
2.
Okay. Why not 3? Because this is a stillborn infant and stillborn infant is dead. Make sense?
Yeah.
Yes, ma'am.
All right, good. So always try to separate the pregnancies and the outcome. Make sense to you guys? Pregnancies, gravida is separate, outcome is separate, and everything is based on timeline. All right, so let's do changes during.
Ma'am, I have one question.
Yes,
In
please.
preterm,
Go.
ma'am, please can you like last slide?
Do you want me to stay here?
Yeah, in ma'am twins we count it's a twin. We in preterm we count 2.
No. Why? You have 31 weeks and 23. That's why you counted 2. Anything.
Stillborn is also in. Okay.
Because anything,
Okay.
like I mentioned this again and again, everything is 1, except when you're counting how many living children does she have. Everything else will be 1, even it's double, triple, whatever. Okay, please don't get tripped with it. It's very important that you focus on this part because this is where your answer is going to change, right? Let's do changes during pregnancy. Lots of questions in NCLEX about it. I know it's tedious to remember, but we're going to do it together. We're going to do our best to remember as much as we can, or else you can take a picture of this screenshot. You guys have like students who are from demo. I know you guys don't have access to these presentations, but the students who have access to the presentations, in the end, you're going to get this book anyway. I think it will open. I don't know if Alveen already opened up the book for you guys. We do, after the end of the second month, we do send you the PDF of these books in WhatsApp group so that you, if you want to print it. But right now, our focus is not to send you these books because otherwise you will be limited to this information. Okay, we want you to understand first and then use them as the revision resource in the end. Okay, all right. So let me try that. Okay. Pregnancy physiology, what are the changes you see? So if you divide them by system, so much easier rather than remembering what all changes during pregnancy. So integumentary is which system? Skin. Sorry, Pearl, you have a question? Your hands up.
Can you please zoom in?
I can, absolutely. I was thinking about it. You read my mind. But you're going to have to tell me to zoom out because sometimes I forget, right? You know. Okay. So integumentary systems, striae gravidarum, and these terms are important. Okay. Striae gravidarum, stretch gravida means what? What is the meaning of gravida? Pregnancy.
Pregnancy.
Okay, so it's related to pregnancy. Any of the colors related to pregnancy changes is known as striae gravidarum. Sometimes my system just don't. Okay. Stretch marks on the abdomen, breast, hips, etc. And they may cause itching. Okay, may, not 100%. Cloasma is the mask of pregnancy. And have you seen the butterflies on the face? Okay.
Yes.
So brownish hyperpigmentation of the skin, cheek, nose, and forehead. Does it go away?
Yes. After pregnancy.
Yeah,
Yeah.
it does. It
can.
right? Because it is due to the hormones. Skin color changes is due to the hormones. Palmar arrhythmia. What is Palmar? Palm arrhythmia means red. Okay. Red mottled blotchy. Okay. Next one is linea nigra. Everybody knows about linea nigra?
Yes, ma'am.
Yes.
Right? So linea means line and nigra means dark. So means black line. It presents as a vertical line. It's very important that you realize what is the difference between striae gravidarum and the vertical line. Okay. So vertical line is linea nigra. Means black line. It presents as a vertical line on belly during pregnancy. What is Montgomery glands or tubercles?
These are
On
present on
areolas?
the nipple, on the areola area.
Small tubular forms on areola.
Sorry, say that again.
It's small pimples like on areola, small pimples.
Yeah, it's like small pimple-like
breast.
structures and appearance
Yeah.
of the areola or nipple. And there is increased hair and nail growth, not necessarily, but it can still happen because of the increased blood circulation. Okay. Next is musculoskeletal. Lordosis. Anyone knows what is lordosis?
Yes, ma'am.
What is lordosis?
Lateral curvature of spine.
Okay. And have you guys seen lordosis? I'm just gonna make a picture
Yes.
for you guys. So it's like increased curvature.
This
You have
one.
seen females like, you know, hand on the back and leaning forward. You see that curve. So it is center of, so it's very important that you know what is lordosis. Center of gravity shifts forward. Why does the center of gravity shift forward? Because there is a baby in the womb. So her center of gravity has shifted forward to an inward curve of the spine. What do you mean by inward? The spine has moved inside. So that's why you see that curve. Okay. Low back pain, muscles are being pulled by the weight of the baby. Carpal tunnel syndrome can also happen. Edema causes pressure on the peripheral nerve. Do you guys know what is carpal tunnel syndrome? It's on the hands. Okay. Calf cramps. Diastasis recti abdominis. What does that mean? Diastasis. Di means two parts of the rectus abdominis is your muscle. So the muscle is separated. Why? Too much pressure in the intra-abdominal area. So you can see the growing uterus causes stretching of the abdominal wall. Non-pregnant, you probably have 6 abs, like 8 abs or whatever. Diastasis recti abdominis during pregnancy, the skin is loose and it will take some time to come back. Now, there is increased risk for falls, and that's important from safety perspective because they may ask, like we're going to do a question and then it will come. So I'm not going to talk about it right now. Next is renal. What is GFR?
Glomerular filtration
Glomerular
rate.
filtration
Glomerular
Filtration rate.
filtration rate is increased. What does that mean? because there is more plasma volume. The amount of blood has increased. Circulatory overload can happen. Like the female, why do you have more blood now? Because you have to provide the nutrients to the baby. Okay, we will talk about a term known as physiological anemia, and we will like discuss that more. Smooth muscle relaxation. Who's responsible for smooth muscle relaxation? Progesterone of bladder and renal pelvis. More urine is held in the bladder and becomes stagnant, allowing bacteria for growth. Another important thing, when you have to like get the urine out, the urinary bladder contracts. The muscle contracts to get the urine out. When it's relaxed, that means the urine is just sitting inside relaxing. If you want to remember this, it's important that you remember urine is relaxing in the bladder. If you want the urine to come out, what the bladder has to do? It has to contract. It's like, think about a balloon filled of water. Okay. When the balloon is filled with water, the water is relaxing inside the balloon. But if you want the water to come out, you will just contract and it will come out. So again, urinary bladder is relaxed. Urine is staying inside the bladder for more amount of time. Don't mix up urinary frequency and all that. We are talking about all throughout the pregnancy that this is a risk factor that can happen. Females are at very high risk of developing UTI due to the stagnant. And why is the urine stagnant? Stagnant means staying. So
inside.
Please make sure you remember these terminologies. Stagnant means staying inside. And that is because of the hormone progesterone. Okay. So increased risk for UTI. Again, the question can come in NCLEX about prevention of UTI. You are talking about maternity and they are mixing up which system? Renal system. So they will not ask you questions basically on maternity. It's going to come from all over. And maybe in the end, the question is about fundamentals. How do you collect a urine sample? Okay. So NCLEX does not ask questions like that. They will test you that do you understand the situation that what you're answering to. Okay. It's in the end, it's all about patient safety. If you can save the patient, you will win the NCLEX. Your goal when you joined us, your goal is not just to memorize all this information and go write the exam. Your goal is to come on the field as a smart, intelligent RN that people respect and people ask questions from. Okay. Now, increased urgency, frequency, and nocturia is due to what? Increased progesterone. So increased progesterone will decrease the tone of bladder. What is the meaning of that? Decreasing tone of bladder means decreased contraction of the bladder, ureter and urethra. Okay. So prevention of UTI, we will talk a lot about it, and don't take it lightly. This is very important from health teaching perspective, and as simple and as, what do you call it? Armless, it seems. It's the most armed, dangerous equipment they have to test you. Simple. Health teachings is most dangerous. Many people get questions on health teaching because if you don't know what to tell the patient, you don't know. You are going to lead, like the patient's going to have an infection. So drink lots of water to flush out the urinary tract. Cranberry juice can help prevent and control the symptoms. Wipe from front to back. Very important. Void after intercourse. Very important. You have to tell this to your patient. Avoid bubble baths, perfumes or sprays. Why? Why do you avoid bubble baths, perfumes or sprays? It will alter the pH of the tract, leading to infection. Wear non-tight cotton underwear. Why can't you wear a polystyrene underwear? You know why? Because, when we all go to gym, what kind of clothes do we wear? That can soak all the sweat and you're wearing athletic. They are polyesters. But cotton, if you ever wear a t-shirt to the gym with cotton, it's like you're so sweaty and you're like, oh my God, my t-shirt is so wet. Okay. So polyester absorbs everything and can lead to infection, but cotton does not absorb everything. It just gives you air to breathe. That's why cotton underwears are recommended over polyesters, especially during pregnancy and the person who's at risk of UTI. Hematologically, there is a decreased hemoglobin and hematocrit. Why? Because imagine if you put sugar, if I put like 2 spoons of sugar in my cup of coffee, versus now I'm drinking coffee from a bottle. What's going to happen? Am I going to taste the same amount of sugar? Like if the bottle is filled? No, it's diluted. Right? Same as with the RBCs. Now, if I have RBCs in this much amount of liquid versus a bigger bottle of liquid, how much RBC? What happens to the RBC? They got diluted. So this is known as hemodilution. More blood. It diluted the RBCs, leading to physiological anemia. Physiological means, so there is a difference between physiological and pathological. Pathological means there is a disease process, there is a pathology, there is a problem, pathology. Physiological means your body has created the environment for it to be like that. Okay, which is usually harmless, but we do encourage the patient to eat nutrient dense diet and avoid the high mercury rich like fish and all that stuff. We will be talking about that too. But right now you need to know that physiological anemia is physiological and it's okay. Increased blood volume is diluting. So what happened? I increased the amount of water in my bottle. It diluted the sugar, leading to hemodilution. Plasma volume is greater than the amount of red blood cells, means hemodilution. Physiological anemia. So plasma volume is low, RBC volume is plasma volume is high, RBC volume is low. Fibrinogen, what is the purpose of fibrinogen? Clotting. Okay. Pregnant women are hypercoagulable, which increases the risk for DVT. What is DVTs?
Deep vein thrombosis.
Deep vein thrombosis. And deep vein thrombosis has a triad. Anyone remembers? What shows triad? Damage of endothelial lining. What else? Hypercoagulability. What is the third one? If I tell you everything, what are you going to do? Tell me the third of the Virchow triad, please. Google it if you don't know. Hypercoagulability, endothelial damage, and what is the third component? That is your another assignment for tomorrow. What is the first assignment that you guys have?
Stasis of like blood flow.
Sorry? Stasis. Yeah. Okay, good. All right. Alveen will teach you all this because that's her system, because it's part of the peripheral venous system. Okay, so we already did a little bit of that. Relaxin and progesterone relaxes smooth muscles. Relaxin, relaxing the body. Estrogen, as I already told you, E stands for everything is growing. Growth of the uterus, placenta, growth of new blood vessels, etc. Human chorionic gonadotropin, HCG. The placenta produces HCG during pregnancy and it prevents menstruation. How? Do you know? It is in one of the slides that I just taught you. Anyhow, let's go to cardiovascular. Increase in cardiac output. Why do you have increase in cardiac output? Because you have more volume, right? More volume is flowing through the body. Your plasma volume has increased, increased heart rate, increased stroke volume. Blood pressure stays the same, sometimes decrease it, but if blood pressure increases, sorry, I don't know what's your name. It says Poco on the side. Please don't mute yourself. Please don't unmute yourself. Okay. All right. So blood pressure usually stays the same, but if it goes up, are we concerned? What are we concerned about when the blood pressure goes up?
Eclampsia.
Preeclampsia. Eclampsia is a different term. Preeclampsia. What is the difference between eclampsia and preeclampsia? Eclampsia means seizure.
Eclampsia, seizures happens.
Yeah. Preeclampsia is before the seizure. That's a dangerous stage because patient can have a seizure anytime. But preeclampsia is also one of the very important topics in NCLEX. Multiple questions and case studies come on preeclampsia, and I'm going to take like a whole half class to just teach you preeclampsia. Blood pressure. So now important part is blood pressure stays the same or slightly decreased. Blood pressure should not be increased. This could indicate preeclampsia. Okay, if you focus here too. Increase in blood volume will cause edema. Have you heard about that? My feet are swollen when women are pregnant. My feet size has increased. It's because of the edema. Okay. This is a question one of my students got, like enlargement of the heart. That was one of the options. She's like, ma'am, I was so surprised that you talked about it and it came in the exam. The heart enlarges. Mostly it develops a systolic murmur, but this murmur is not alarming and is not permanent. So if you get a question in priority and one of the options says female who's pregnant, 20 weeks pregnant, has a systolic murmur, don't choose it as your priority, because what is it? Expected sign. Expected physiological change of pregnancy. Right. Cardiac rhythm may experience palpitation and cardiac dysrhythmia. Healthy women, no therapy needed. But if somebody has a history of cardiac disease, that is dangerous, because think about it. If somebody has a history of cardiac disease and they develop palpitations, you want to further investigate. Okay. Hypercoagulable, we talked about it, and it is because of the increased fibrinogen level, because non-pregnant, it's 200 to 400. Pregnant, it's up to 600 milligram per deciliter, which is high. So it increases the risk for deep vein thrombosis. Now, respiratory system, increased basal metabolic rate. The metabolism is fast. You have more need for oxygen. Why? Because the fetus also needs oxygen, right? So you have higher needs of oxygen. Fetus needs oxygen, and there is a lot of growing tissue. Every growing cell in the body needs what? Oxygen. Okay. Mild respiratory alkalosis, the pH can be high. The Alvin has already taught you, I think, blood gases, right? So I think you guys all know what is respiratory alkalosis versus acidosis and all that. Chest increases in size. Why? Because you need to, adapt. The fetus has to need the room. So your chest is enlarging. Also, the breasts are enlarging. So it's just for the physiological changes. Increased vascularity of upper respiratory tract. Have you seen people being stuffy? Like they're so stuffy when they're pregnant. Some of them, not everybody, but some people are so stuffy. I was so stuffy. Stuffy means my nose was always stuffed, and I felt so irritated because of increased vascularity. Okay, so congestion, runny nose, inflammation, all same thing. Increased vascularity to cervix, vaginal organs, uterus, softening of the lower uterine tract is preparation of pregnancy. Same with the respiratory. We are getting more circulation, and then hence you feel more stuffed nose and congestion. GI, nausea and vomiting, we talked about the morning sickness already, and is most common during the first trimester. But if it continues and it affects the patient's eating and the patient is unable to keep anything down, it could be hyperemesis gravidarum. Now, hyper means more, emesis means vomiting, gravidarum means pregnancy, because gravida is pregnancy. Okay, so you always have to remember, you have to learn how to break down the terms, because not every term on NCLEX we're gonna remember. Like it's too hard to remember everything, but learn. Hyper means high. Emesis is vomiting, more vomiting. Gravidarum is related to pregnancy. So severe morning sickness may require hospitalization. Pyrosis is burning. If you pyria, the word PYR, if you Google it, refers to fire or burning. So now we're talking about pyrosis is heartburn. NCLEX might not write heartburn. So you need to know what pyrosis is: fire, heartburn. Okay, so please remember this term. And why is the pyrosis happening? Progesterone. Why is progesterone causing it? Because the lower esophageal sphincter, so you have esophagus, right? The lower esophageal sphincter is relaxed. Means what? It's open its door to the stomach acid to come back, and you feel it in your throat. That is known as heartburn. Okay. Constipation, again, the gut mobility has decreased, so the stool is not going out. So what does the female have? Constipation. Okay. Hemorrhoids, why the patient is at higher risk of hemorrhoids? Because, more circulation to these areas. So hemorrhoids are what? What are hemorrhoids? Inflamed veins in the anus. Symptoms can include itching, pain, and bleeding with defecation. Pica, anybody knows what is pica? Pica is like craving the substances that are not actually food, like craving chalks, craving paper, clay, stuff like that. Swollen mouth and gums. Gums become swollen and easily bleed, may develop epulis, red nodules on the gum. This is a term that you can remember. NCLEX has not asked for epulis, but you can remember if you want. Now, if all of these are signs and symptoms, you have to do what? Patient teaching, right? How can we help the patient? These are not the things that necessarily need medication, but can we help the patient? So prevention treatment of heartburn. Heartburn is like, don't eat big meals, spicy meals, don't drink too much, like anything that is causing distended abdomen, don't do it, because distended abdomen means the acid will go back. Okay, so do not lie down after meals. Eat small frequent meals. Avoid greasy foods, spicy foods, trigger foods. I loved all those foods, and those are the foods they tell you to avoid, so it's really, really hard. Okay. Next is prevention of constipation, and you will see this a lot with Christine. She will write fluid and this fills the toilet. Fruits, fiber, and fluids fill up the toilet. Okay, so this will come again and again in her slides whenever we'll do it. Okay, I have another slide, and after that, I'm going to let you ask me questions. Okay. So again, same slide, but I'm just repeating it. So I, like, as we promised, we use multiple resources to kind of help you understand. Whatever works for you, use that. But so I'm going to mute you. So physiological changes in pregnancy, again, same thing, we are repeating them, but it is just on one slide. If you are from just the demo class, please take a picture of this. But students who are actually from the registered class, again, you're going to get this all in the material that you have. So if we talk about respiratory system, increased, and NCLEX has asked question from this slide. And as I've told you that my student got the question on heart enlargement, and she told me, she's like, ma'am, there was this slide on your presentation where the heart was like slightly bigger, and she remembered that, and it's been a while, but she was like, I knew instantly that that's true. So increase in tidal volume, increase oxygen consumption, we just talked about it. Elevated diaphragm, why? Because you need more room for the fetus to grow. Nasal stuffiness, epistaxis, because of nasal congestion. Breast, Mane, you have a question?
Increase in tidal volume means that in and out of the oxygen and carbon dioxide.
Alvin must have done this for you guys. I'm not the respiratory specialist, but increase in tidal volume means your needs have increased.
Okay.
Okay. So increased breast size, we know why. Estrogen, heaviness, tingling, darkening of the nipple is the color. Colostrum can start forming. Then GI, we just covered it. Pregnancy gingivitis, the epulis term that we use, that there are gums and there is swollen. Increase in saliva, increase in saliva is known as botulism, if you can remember, great. Alvin will talk about these terminologies in GI. Decreased gastric acidity, nausea and vomiting, heartburn, decreased tone and motility of smooth muscles. And what would that cause? Constipation, hemorrhoids, decreased emptying of the gallbladder. Okay. Because why? Gallbladder is also a muscle. Okay. Vagina, estrogen influence, and estrogen will change the color. Smooth muscle hypertrophy, hyperplasia of the lining, increased thick white secretions, leukorrhea. Leuc word is connected to white, like leukemia, white blood cells. So leuc word is always related to whitish secretions. So it says increase white secretions. Chadwick sign, what is the Chadwick sign? It is the purplish, reddish,
reddish
sign.
color.
Yeah. Color of the mucosa. Then we talk about integumentary. We already talked about it. Changes in the skill. Chloasma, we talked about. Linea nigra, striae, gravidarum, we talked about all them. Increased skin pigmentation, chloasma. Acne, dermatitis can happen. Vascular spider nevi are the small blood vessels that you see on the abdomen. Abdominal stretch marks, striae, gravidarum, and linea nigra. Then nutrition, and I am going to focus on nutrition in the next class too, because this is an important topic, and NCLEX loves to ask you questions about nutrition. Although everything here is important, but the goal is to understand, not trying to memorize. Okay. Normal weight gain is 25 to 35 pounds. Again, I'm going to take weight gain specifically as a topic and teach you. For single fetus and women with normal BMI, that's why I told you weight gain matters. It changes if someone's BMI is high. So balanced diet, increase folic acid and iron. Why do you need increased folic acid? What are you trying to prevent? Neural
Neural
tube
tube
defects. Neural tube defects. And I will tell you one very cool thing. Neural tube defects occur before the female even knows she's pregnant. Okay, so that I'm just gonna mute you. I don't want to remove anyone. I'm so sorry, but like when you guys don't mute yourself, other people get disturbed and distracted. So please respect that. Increase calorie intake by 300 to 500 kilocalories per day for second and third trimester respectively. Don't think when people say, oh my God, you have to eat for 2 now. So, okay, I am supposed to eat 2,000. You want me to eat 4,000? No, that's not true. People don't have to eat lots. It depends on the balanced nutritional diet. Increased need for water.
Baby?
Musculoskeletal. Ashmi, you have a question? So increased lumbosacral curve, we talk about lordosis. It's known as increased lumbosacral curve. Altered center of gravity, we talked about, and duck waddling gait. Have you seen, like when I was pregnant, how I was walking? I was like a duck, right? So it's known as duck waddling gait because the center of gravity has moved. So I need more space in between my feet to balance myself. Cardiovascular, increased blood volume, increase in heart rate 10 to 15 beats per minute, increased cardiac palpitations. It's okay if the patient has palpitations, but she should not have a previous cardiac history, because if she has a cardiac history, then it's a concern. Murmurs, systolic murmurs, we just talked about that. It's okay. Pseudo means fake anemia, but this is known as physiological anemia. Okay. Urinary and renal, we talked about the frequency. Decreased bladder tone means decreased bladder contraction, meaning what? Decreased renal threshold for sugar. So this bladder tone is the one we talk about, stagnant urine, UTI risk, all that. Decreased threshold for sugar means you will have glycosuria. The renal system won't hold on any extra sugar in the body. So females can have glycosuria, means glucose in the urine. Increased glomerular filtration. Why? Because your blood volume has increased and blood volume has to be filtered through the kidney. So glomerular filtration. Uterus increase in size and weight. Lightening. What is lightening? Lightening occurs towards the end of the pregnancy, around like 37, 38 weeks, when the fetus head drops down. Okay, we will talk about the fundal height. Sorry. So sorry, guys. Okay. Braxton Hicks, we all know what is Braxton Hicks are practice contractions, false labor. So they are contracting the uterus in a way to make it ready that, hey, you know what? One day you have to contract and deliver this baby out. Let's just do some practice. That is Braxton Hicks contractions. Cervical softening, Goodell sign, mucus plug also. Endocrine system, we did talk about it a little bit. So placenta, because of the what is the function of placenta? Nutrient to the baby through the umbilical cord and waste away from the baby. It produces human chorionic gonadotropin, prolactin, or HCS. Thyroid, in basal metabolic rate is going to go up. So increase in size of the thyroid and activity, basal metabolic rate, increase parathyroid activity. Pituitary produces FSH, LH, thyrotropin, adrenotropic, and prolactin. Not necessarily that you need to remember what it produces, but the function is important. Okay, so this is one of my slides for you. Believe you can, and you're halfway there. So before you guys even think about that you're going to be an RN, I want all of you, every single person, to take a sticky note, write your name on it, and write RN. Okay, and write, like, just make sure that you stick it somewhere that you see every single day. Okay, that's one of your assignments to do. We're going to do a question. I'm not finished. I know it sounds like, oh my God, it's finished. It's not. So we're going to do a question together. Any questions from what I have already covered? Nobody has any questions? Did I do really well, or I was really bad? If you guys don't have questions, I don't know. Okay, Shrishti, your hand's up. That's awesome. There is room
Yes,
for
ma'am.
improvement. I am happy.
Yes, ma'am. I Nigel's tool. Why we subtract 3 months?
Why? It's really good to ask why questions, but what do you think? It's a rule. Like, So it's up to you if you want to do the +9 or you want a -3. Okay. So I'm saying January to March, add 9. April to December, -3. Because it will be easier to subtract because then you're counting forward. If you add 9, you are going to the next year and counting. Okay. We will be doing questions. We will be doing questions right now, and that will help you understand more. Anyone else has a question about this part? Everybody's good? I hope so. Okay. So we are practicing question from UWorld. It's a case study. We'll do it together. I don't know the answers, but I did select the 6 questions that I want to do together with you guys. So let's go. Okay. So case studies look like this. Sorry, guys, like, please mute yourself. This is my last, like, request to you. I would have to remove you if you're not able to mute yourself. Please respect that, okay? We are doing questions. Okay. Sorry, I did remove the person. I had to because I can't let the students get too much disturbed. Okay. So the following scenario, can someone read the question for me, please?
Ma'am, can you please zoom?
Okay, I can try. So it's a case study.
28.
Can I read?
Yeah, Kulbir, go ahead, please.
A 20-year-old nulliparous female comes to the clinic for
Sorry, wait, Kulbir, you started reading wrong. Okay, so when we read a question, we're gonna start from the beginning. The following scenario applies to the next 6 items. Every single thing matters. Every single thing. Okay, you're learning how to do questions. Okay.
Okay, ma'am.
Item 1 of 6. This is the first of the 6 questions. The left will remain because this is the case study. So the nurse is caring for a client at Women's Health Clinic. Okay, now you read the question. It says history and physical. Labor and delivery unit. Time is 8 o'clock. 24-hour clock, right? If it says 1400, how much is the time? 2 p.m. Every single thing matters. Okay? Please pay attention, guys. These little things will take you far because this is about attention to detail. Okay, Kulbir, now you can start from a 28-year-old. I'm sorry, I had to tell you that.
A 20-year-old nulliparous female comes to the clinic for confirmation of suspected pregnancy due to amenorrhea and a positive home pregnancy test. The client's current exercise regimen includes indoor cycling and outdoor running. Client reports nausea, vomiting, and breast tenderness. The client has a 28-day menstrual cycle and her last menstrual period was March 10, 2017.
Oh, 10 to 17.
Oh, 10 to 17.
So see, you got to learn how to read this. So it says, so think about it. And her last menstrual period was March 10 to 17.
10 to 17.
Okay? It's a hyphen means 217.
Okay, well.
All right.
The healthcare provider notes a bluish-purple vaginal mucosa and cervix during pelvic examination and confirms a 12-week intrauterine pregnancy by sonography. A handheld Doppler is used to detect a fetal heart rate of 155 per minute.
Okay. Everybody, how do you guys feel? How much you know? You know a lot, don't you? We talked about every single thing. You can pick up so many presumptive signs. You can pick up probable. And can you pick up positive?
Yes.
Yes. Right? So, like, I know sometimes students call me and they're like, ma'am, can I buy UWorld? I will tell you why not. Okay. I'm not saying it's not good. It's really good. But I'll tell you why you don't need UWorld. Because if you have strong knowledge, what is this question to you? Do you think it's difficult? So you tell me, presumptive, what? So this question is asking me to pick amenorrhea under presumptive, probable, or positive. Where am I picking it for you?
Presumptive.
Everybody's good with presumptive?
Yep.
Yes.
Why can't I click it? Oh. I don't know. It doesn't let me click. Okay. I don't know why it doesn't let me. Let me check. Maybe it's telling me I'm logged out. Oh no. Let's see. Okay. So amenorrhea is presumptive. It's not letting me pick. It's okay. We'll do it later. So you guys can write it down. Next, Chadwick sign. What is a Chadwick sign?
Probable sign.
Probable.
Color of the cervix.
You guys thought I understand? I have a very short attention span and I don't understand when everybody talks. So raise your hands and please tell me, enlighten me, brighten me up. Okay. Jado, Chadwick sign. What is Chadwick sign?
Probable.
Bluish color of the vulva and vagina.
Okay. Yeah. Srishti. Why can't I click it? Is it presumptive, probable, or positive? Probable, right? Next is fetal heart rate. Fetal heart rate is presumptive, probable, or positive?
Positive.
Nausea and vomiting.
Presumptive.
Breast tenderness.
Presumptive sign.
Presumptive. And what is the cause of breast? Which hormone is responsible for breast tenderness?
Progesterone.
Estrogen. Home pregnancy test.
Presumptive.
Home pregnancy test is what?
Probable. It's probable.
Can the nurse see it?
Yeah.
Yeah. Can a nurse see it?
No.
Why can't you see it? Why can't
I
you
see it?
Like I'll tell the patient to just bring me the pregnancy stick. Can I see it? Can you observe it?
Yes.
So what kind of sign is it?
Probable.
Probable, because there is O in probable, which makes it objective. I can see it. It's not just patient telling me. Probable. Okay. Fetus visible on ultrasound.
Positive.
Good. Let me, you know what? Let me see why I can't let you guys do the question. Why can't I do it? Like it's not letting me quit. Let me just restart it. Okay. So let's revise the signs. Binder, what are the different signs?
Presumptive, probable, and positive signs of pregnancy.
Okay.
Presumptive includes the symptoms that are subjected by the patient or by the mother. Probable are the objectives that are observed by the healthcare for the nurse.
So why
And
did
positive are the-
everyone kind of pick? Why did everyone pick? I can't click it, man. I don't know. Oh, I know why. Okay, I know. I don't think I can click it, but it's okay. I'm just gonna share my screen. I will share the answers. Okay, but I know why it doesn't let me click. So why did everyone get confused at like the sign which is pregnancy test? Because this is what you're gonna get in question, right? In NCLEX, this is what's coming. So what was the reason for getting confused about it? Anyone can explain me why did they feel that they were confused about it? And I just want to know. I want to help you guys.
Because it says home pregnancy test. I'm thinking
Okay.
like it was
So
done
you
at
thought
home.
that it was done at home, so I can't pick it?
Yes.
Okay. Okay. Anyone else? What was your thought process? Sorry, I'm just gonna. Anyone else? Like, what was your thought process?
I also thought that it is done at home. That's why I.
Okay, good. So everyone who's doing this wrong thinks that because it's done at home. Home pregnancy test is the name of the test kit.
Positive.
It's just known as home pregnancy test. It doesn't matter if it's done at home, it's still an objective. Okay, good. So most of you got this like answer. So this is 1 of 6. Now we go to the question number 2 in the case study. Okay. So this is our question number 2. The case stays on the left side. Do you guys understand that? The case screen, you don't have to reread it, like not necessarily.
Yeah.
But you can always read it because now what am I going to read first? The client's last menstrual period was March 10 to 17. Unprotected
Excuse me, ma'am.
occurred on March 24. The client's menstrual cycles are regular and occur every 28 days. Based on the Nigel's rule, what is the estimated date of birth for the client? Pravinder, your hands up.
Ma'am, actually, I have one question.
Yes.
Yeah, like these are 6 items, so it includes only in one question or 6 different ones?
No, it's like 6 questions will come based on one case scenario.
Okay, so we will get a mark on behalf of one scenario.
Question. Each question is marked. Okay, but you will get 6 questions under one case. Same case.
Okay.
Okay. All right, let's do this question. Please tell me, what do you guys think is the answer? Parul, your hand up.
December 17.
Okay. All right. Anyone else?
December 24.
December.
So, Radha, did you say December 24?
No, ma'am.
I say, ma'am.
Somebody who said December 24, I want you to explain me that, please. It's not that you're wrong or anything. I just want to know what your thought process is. So please help me understand why December. Kulbir, was it you? Is that you? Who said December 20? Now nobody's gonna agree to it that I said December 24. You guys are
I said, ma'am.
Okay, Taran, explain me why. I'm
Actually,
sorry.
I added a 7. I did +7 in the 17, the last one. 10 to 17, so I added 7 in the 17.
Okay, that's okay. All right. Rikisha, is that right? Did I pronounce it right? I'm sorry if I'm messing up the names. You can call me Sabarjit. Sorry, Rikisha, what's your answer?
December 17.
December 17. And why do you have December 17?
So we added 9 months.
You add, okay, yeah, it's March, January to March. So what's the rule? January to March, add 9 months. So 3 plus 9 makes it December. So all the options have December. So there's no doubt about it that what else it can be. It's going to be December. Now, date is important. When I taught you, I want to share something with you guys. I want your focus because I want you to know how important it is when I'm teaching you something. And okay, I should put it. Maybe I'll just share the screen. Let me just show you something that I kept saying one point. Can someone tell me which point did I keep saying again and again?
First day of last
First day
menstrual
of
period.
last
First day of last
First day of
menstrual cycle, right? I kept saying that. I'm gonna see if I can share my screen. Like, oh no, it's fine. Never mind. I have too many screens and I get confused. Okay, so definitely first day matters the most. So students who are thinking 24th, you have to pay attention. Someone's hand is up. You just come up as iPhone 2, so I don't know what's your name. I'm sorry.
Yeah, I'm Veerpal.
Okay, hi Veerpal. Can I change your name, Veerpal?
Hi.
Because I see that. Okay, so how can I help?
I have a confusion this question.
What is your confusion?
I have no clear this one due date questions all that.
Okay, so this is the simplest question on what I taught you guys today. I'm going to explain it one more time. So Nigel's rule, first date of last menstrual cycle. So they say 10 to 17.
Okay.
There's a reason they entered both the dates. They want to trick you. Okay. So 10 plus 7 makes it what? 17. March plus 9 makes it December.
December.
And it's going to happen in the same year. So the year is not mentioned because they know that they can mention it, but they didn't mention it. So the answer is December 17. Anything else does not make sense. I don't know how would you do that. Anyone has any other question about this question? Are we good?
Yes, ma'am.
Yes.
Okay, let's do the next question. I don't know why it's not letting me do anything. UWorld is so like they don't want people to even click anywhere. Okay, which of the following topics should the nurse address during the initial prenatal visit? Okay, so select all that apply is partial scoring and should be done as true and false statements. Okay, think about the timeline and then try to answer it. So option one, commitment to pain management preferences in labor. You are talking about initial prenatal visit. Is it important?
No.
No.
No. No.
When is it important? Third
The
trimester.
third
And
trimester.
also, my feelings can change. Right now, I'm saying, oh, I'm not going to take any pain management. I'm just going to have a natural delivery. And when actually the delivery comes, I'm like, oh my God, I'm in so much pain. Can you give me epidural? Right? So when is it going to matter? Towards the end, right? Number two, expected discomforts of pregnancy.
Yes.
Yeah, right? What kind of discomforts? Heartburn, nausea and vomiting,
Breast enlargement,
breast
Constipation,
enlargement, all those little things that, oh my
pain,
God, presumptive
Nausea,
signs.
vomiting.
urine.
Foods to avoid, is it important? Very
Yes.
important.
Yes. Very important.
Very important. Diphtheria in the daily meats can cause premature labor, intellectual disability in the kids, so many problems. Miscarriage. So daily meat should be avoided. Fish high in mercury should be avoided. Can anyone tell me which fish are high in mercury? Oh, shark. King mackerel, shark, swordfish. Okay, but the females are allowed to eat shellfish, shrimp. They are allowed to eat because they're good sources of protein, but not the fish which is high in mercury, because it can damage the neurodevelopment of the baby, and neurodevelopment occurs in the what? First 3 months. And which visit is it? Initial. Okay. So food is important. Herbal supplements and over-the-counter medications to avoid. Yeah, of course.
Yes.
Like,
Yes.
don't take anything that's gonna, right? Method of delivery.
No.
No, not me.
Until unless there is a complication, the delivery is gonna happen. Naturally, vaginal delivery is recommended. Until unless there is a complication, or until unless there is placenta previa and you can't have a normal vaginal delivery, or patient has diabetes, large for gestational age, CPD, cephalopelvic disproportion, all those things. I know these terms sound foreign to you, but I'm going to teach you everything. Okay. Symptoms of potential pregnancy complications. Should we be talking about that?
Yes.
Yeah.
Yes.
Preeclampsia. Gestational, like all those things, we do need to talk about them, that if you feel this way, because she can have a miscarriage, like vaginal bleeding can happen anytime. Patient can have an abortion. She should know that, oh my God, vaginal bleeding during the pregnancy, in any stage of pregnancy, is never good. Okay. All right. So we did 3 questions. How do you guys feel about it? How much did you know?
Good.
Right? You know a lot. Trust me, you do, because you just studied the system really, really well. Let's do the next one. Which of the following lab tests should the nurse anticipate during the first prenatal visit? Select all that apply. What is the meaning of anticipate?
Before.
Wrong.
Yeah.
Expect. Don't. Anticipate is a very common terminology. Please Google it. That's why my strong recommendation not to study in your mother tongue and study in English. Anticipate means, what do you expect? What kind of lab test should be expected during the prenatal visit? Please Google the term anticipate. It's very important. It's going to come in your exam. Okay. So NCLEX is the test of your vocabulary, the test of your comprehension. How much do you understand? Can you comprehend what the patient is trying to tell you? Okay. Because you will be working with the doctors. If you don't understand the basic English, how can they communicate with you? Okay. So first prenatal visit, what about 1 hour glucose tolerance test? When do you do OGT? No.
The second trimester.
Second trimester.
Trimester.
24 weeks, 6 months. Okay, OGTT is done because that is the time when there is so many changes, and we should expect that if that is when the mother will be diagnosed with gestational diabetes, not before that. Okay. Group B, streptococcus rectovaginal culture.
No.
No.
Third trimester, around 36 weeks. Okay, GBS. This is known as GBS. Maternal blood type and screen.
Yes.
Yes.
Yes. Yes.
Confirmed RH incompatibility.
Yeah.
STI screening, sexually transmitted infection screening.
Yes.
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 Urinalysis? Yes.
Yes.
Needed.
Okay, good. So we did 4. This is the 5th one. The nurse reviews the progress note as the client return. Oh, this is the progress note. Sorry. We did health and history. So make sure you click the tab. I didn't click it because I didn't need it yet, right? Now I need it because I'm looking for where is the progress note. Okay, so make sure you pay attention. Like, don't do what I did. I didn't read it. But still, like, I could keep going. But now I need to look at what is the progress note? What does the progress note say? Okay, because the question is saying the nurse reviews the client's progress note. Which progress note? Where is the progress note? Do you know what I mean? So you look for it because all these tabs have importance. So progress note says pre-pregnancy height is 5 feet 5 inches, weight is 140 pounds, and BMI is 23.3 kilos. What is the normal BMI? 18.5 to 24.9.
24.9.
Is she normal? Is her BMI normal? Yes.
Yes.
12-week gestation, her weight is 150 pounds. 16-week gestation, her weight is 160 pounds. Okay. How many like this is 12 weeks. Now this is 16 weeks. That means 4 weeks in between, right? So she has gained 10 pounds in 4 weeks. Now let's look at the options. What are the, it may be relevant to the question. It may not be. So they're just like trying to waste your time in you reading the question. Technically, what I usually do, I'm going to tell you. I will read the question, I'll read the option, and then I'll go to the progress note to see, do I need to really pay attention to it? Make sense? Okay.
Yes, ma'am.
So which of the following statement by the nurse is appropriate? So what are you looking for? True statements. Okay. Appropriate means which of the following statements are true? Select all that apply. So avoid carbohydrates as much as possible during pregnancy. Why? Why do I have to avoid carbohydrates? I have nausea and vomiting. I want to eat dry crackers. Why do I avoid carbohydrates? So this is wrong option.
Wrong answer.
Oh, it's letting me do all these things, but not pick the answers. Begin a sodium restricted diet to prevent gestational hypertension.
No.
No.
There is no indication. And why do I have to eat sodium restricted diet? I am not, like, it doesn't say that I'm at risk of hypertension. Consume nutrient dense foods with each meal. Is there anything wrong?
Yes.
Yes.
No.
No, right? Nothing's wrong. Oh, I can't pick it. Like, that's so weird. Number 4, engage in moderate exercise such as walking or yoga for 30 minutes daily.
Yes.
Yes.
Exercise is encouraged. You should exercise during pregnancy. It's good because you will stay healthy and your labor will be easier if you are exercising. So moderate exercise is good. Okay. Increase consumption of iron-rich foods such as meat. True or false?
Yes.
Why? Because you have what? Physiological. Okay. So now you see the tabs increasing.
Ma'am, in the last question, why we didn't select the third option?
Sorry?
Why we didn't select the third option?
We did. It's just I can't click on anything. I don't know why.
So it's 3, 4, 5.
Okay.
So the answer will be 3, 4, and 5. Yeah, that's right.
Okay.
Okay. So now they have nurses' notes too. So you see history and physical progress notes, nurses' note. Okay. So client comes to the clinic for a 20-week gestation prenatal visit, denies bleeding or cramping, vital signs and physical examination are normal. Current weight is 157 pounds, states that she is feeling well overall. That's good, right? Like nothing's wrong with that. What is the question saying? The client returns to the clinic for 20-week gestation prenatal visit. 20 weeks is an important, 20 weeks is when we do the full ultrasound, and you have to spend like 2 hours in the ultrasound, because what are they doing? They're doing morphology. And to do morphology, you have to visualize every single organ of the baby, because 20 weeks is the time period. Halfway pregnancy, the baby is fully formed, and you can check the heart rate, you can check the limbs are there, the gender reveal, everything. Okay, 20 weeks is an important time. So which statement requires further teaching? What does that mean? Further teaching means false statement. So she says, I added gymnastics into my exercise routine. Oh my God. Gymnastic is jumping around.
Yes.
Not safe. Because why is gymnastic not safe? She has lordosis. The lumbosacral curve, her center of gravity is already off. Gymnastics is a high energetic sport. That is dangerous. Okay, so that's my first option. I'm going to keep it. But what did I tell you? What do you have to do? Can you stop at option 1 and stop?
No.
You have to read every
No.
single option. What if I'm wrong? What if what I thought is wrong? Because maybe I have to read the question twice. So always read the options twice. Once to see what's there, and secondly to pick. Okay. So for example, you go in a restaurant, you get the menu, and once you see, you pick the things. That's it. Then they take away the menu. Do they give it back? Do they give you? No, until you ask for it.
No.
So you only read the options twice. Once, I want to see what's in your menu, and then I'll pick it and I give it back. And it doesn't come back. Okay. Make sense? I know I'm giving you like a weird example, but I hope it makes sense. So the menu has to go back. You can't keep reading it, because that will mean you are not sure. You are questioning your initial judgment, and you are confused. And then you're going to start adding things on your own in the statements, which did not exist in the first place. So confidence is the key. And confidence comes from knowledge. And knowledge is power. Okay.
Power.
So the second option, I eat carbohydrates that are high in fiber. Good. Why? Because constipation. Okay. Because progesterone decreases the gut motility. You always need to find out the reason. Why are you telling me the option is wrong? I don't care if you chose the first right option. Great. But why are the other 3 wrong? What's your reasoning? So always find the reason. Why is this option wrong? Versus trying to find why is this correct? Because the correct could be I read it in a book. But maybe that's not true. Okay. So I eat salmon once per week. Great. Salmon is great source of protein. Good. It's not a high mercury fish. I go to an indoor cycling class 3 times per week. Great. Okay. So what's our answer? I added gymnastics to my exercise routine. This was the case study. I think this is preeclampsia or something. So I'm not, yeah, it's deceleration, acceleration. I have not taught you that yet. But I want to know from everyone, how do you guys feel right now? How do you feel more confident? Do you think you can pick the questions? You feel like,
Yes,
I
ma'am.
know I'm 4 minutes over my time, but I hope, everybody enjoy it. I don't know. I love teaching you guys, so it was very enjoyable. You can tell how much I love teaching. I absolutely love it. So any questions, I'm here for the next 5 minutes. But if you're done with me, you have had enough of me. Thank you so much. And we will meet tomorrow. And I hope to see you guys again. Cycling is safe. Yes, cycling is safe. Okay.
Ma'am, I have one question.
Yes, Ashmi.
Ma'am, if the pregnant woman, sorry, in the delivery room, the woman is in labor and she was given epidural and she's already 10 centimeter dilated.
Oh,
Is that
Ashmi, you
emergency
just
condition?
jumped. No, wait. So if I answer your question, you've already jumped. Many people don't know that which stage of labor epidural can be given. So I will answer your question. You can text me because I know you have already like studied this part, but I will answer your question when we do the topic. If you want to wait, or you can text me and I will answer your question because I know what you're asking me, but
Okay,
others
sure, ma'am.
and it will confuse them. So
Sure, thank
Ashmi is
you.
talking about pain management during labor, stages of labor. So before I can't answer that question because I don't want to confuse any of you. But if anyone has questions related to today's topic, what did we cover? We covered we covered anatomy of pregnancy, sign and symptoms, presumptive, probable, and positive. Presumptive is what is the female subjectively thinking, oh, I'm pregnant. Probable, objective. O for probable, presumptive. S is for subject. What does the subject think? O is objective, that we can see, and home pregnancy test is just the name of the term. You can still see it. Positive is things that I can feel with my hands, I can see with my eyes, and I can hear with my ears. Okay, my ears. So it's like if you can't see it, if you can't hear it, if you can't touch it, it's not there, right? Like, I don't know. That's why even this question said that it was like the doctor confirmed the pregnancy with the sonography. Okay, even if you read the question, you guys already knew so much information. Like you don't even need to. If I just send, like, you know, if I just show you the screenshot again, you will be like, yeah, I know exactly what's going on, right? Like I know exactly what are they trying to ask me. I'm just going to share my screen for 1 second. I know I'm taking your time, but you guys can leave if you want to. So look here, nulliparous female. Nulliparous means never gave birth. Remember we talked about never gave birth past 20 weeks. Nullipara means birthing history. Comes to the clinic for confirmation of suspected pregnancy. How did she suspect pregnancy? She's nauseous. She has emesis, breast tenderness, amenorrhea. Current exercise regime, indoor cycling, which is good. Client reports nausea, vomiting, breast tenderness. Client reports, what kind of signs are these? Subjective.
Subjective.
Client has a 28-day menstrual cycle, and then they told you LMP. The healthcare provider notes bluish coloration. What kind of sign is it? Probable. Because what are we talking about? Chadwick sign. Color is C. C is for Chadwick. Cervix during pelvic exam and confirms a 12-week intrauterine pregnancy by sonography.
Sonography.
A handheld Doppler, I can hear the Doppler 155 beats per minute. Okay, so, okay. And then what did we do after that? We talked about the change, which is very important, physiological changes, because there is terminology that you do need to remember. Mane, your hands up. You guys can.
I have a doubt regarding the weight gain in pregnancy that
I didn't teach you weight gain yet, Mane. I will be taking that as a separate complete because it's so important. Nutrition and weight gain in pregnancy is very important.
I legit got confused with like 10 gaining 10 pounds and then after that because I don't know how to divide it, like it was a bit confusing for me.
There is some memory, but you need to know the exact number. So I'm going to teach you guys. I have slides from Archers to teach you the weight gain. So we don't only just, like, I don't just use UWorld. I wanted to show you this, that UWorld is not trying to trick you. It's simply, if somebody tells you, oh, I'm scoring 55% at UWorld, my answer is, you have 55% of knowledge. Because think about this case study. You all would have scored 6 out of 6 on this case study because you studied well, right? So it's not about that. The questions in NCLEX are going to be more trickier. UWorld's not tricky. It doesn't trick people. It's just simple. Their explanation is really good, but it doesn't really give you what we need. Okay. All right, guys. Thank you so much for joining. And I think so many thank yous. Thank you. You guys are so sweet. And I hope to see you guys tomorrow. Any questions, please drop them in the chat. And I know some of you are asking, is there anybody from like, you know, South Indian and stuff? We probably will be making smaller groups too. We still have lots of students to add to the group. We get students every day. So slightly they just get added to the group. Some people like to join a little later because of their commitments and stuff, but we will be making smaller groups. Usually we make it based on the region so that you can study together, but you can choose your ethnicity or you can stay, like you guys are going to be friends. Like, trust me, I have seen lots of students becoming friends in our previous batches too. So we will have a strong relationship by the end of the 3 months. I hope so. So any questions, please let me know. And it was a pleasure teaching you today.